Typically, MedCircle creates mental health educational videos, but we thought it was really important to discuss the intersection of cancer and mental health. Hi, I'm Kyle Kittleson with MedCircle, and MedCircle and FCancer has partnered to create this masterclass. In this video, you're going to hear from some of our MedCircle doctors, mental health professionals, to provide insight and education and helpful tips, whether it's you or someone you love moving through a cancer treatment. We'll also hear from people not regularly seen on MedCircle, other people in the cancer community and other cancer survivors so that they can share their tips and their stories. It's our hope that this video provides not only education, but inspiration for those in need. I thank you for taking the time to watch this. And if you would like to get involved with FCancer, use the links below this video. Remember, whatever you're going through, you got this. Hi, I'm Kyle Kittleson with MedCircle, and I'm joined today by two fabulous women. First, Heather Kuhn, the CEO of FCancer. Heather, it is so fabulous to bring you on MedCircle.
Well, thank you. Thanks for having us. We're really excited to share kind of who we are and how we can really work to prevent and find cancer early.
In just a little bit, we'll have psychiatrist Dr. Christy Lamb and MedCircle doctor joining us. But Heather, let's start with you and talk about exactly what FCancer is and what you guys are all about.
Sure. So we really like to say we kind of step in where other charities have left off. We don't focus on research. We focus on advancing health equity, both through prevention and early detection. So finding that cancer early, before it gets to you and you have to go through treatment. And that's done both through educational programs as well as on the ground programs at clinics. In addition to that, too, we like to support our patients once they have been diagnosed to make sure that they're feeling supported throughout their diagnosis and experience with cancer, both during and after.
And do you have a personal experience with cancer? I mean, we all do in some capacity. Yeah.
Yeah. So my mom at my age, actually exactly, was diagnosed with leukemia. She went through years of radiation, years of chemo, and then a bone marrow transplant and survived, which at the time was unbelievable. Unfortunately, all that radiation caused another cancer, which she got when she was 60 and had endometrial cancer, which spread to her lungs. And now she has lung cancer, but she's 73. So she's outlived anyone's expectations. So to see my mom go through this, she really is a true survivor.
Wow, that was my word exactly, a true survivor. You're certainly in this cancer space and you really understand the prevalency. Could you help me and our viewers understand just how prevalent cancer is today?
Yeah, cancer is everywhere. Everyone has a story, everyone either personally or not. Up to 40% of people will have cancer in their lifetime. That includes skin cancer. So don't get too, scared there, but it's very prevalent. Last year alone, we had almost 2 million new cancer cases that were diagnosed. In terms of deaths, we had about 600,000 cancer deaths, which, just to put in perspective, is almost double the COVID deaths in 2020. So it truly is not an infectious epidemic, but it is an epidemic that, we have to really focus on as an acute issue.
Yeah, no question. Are there specific groups that tend to be more vulnerable, either because of lack of resources or the inability to get that early detection you spoke of?
Definitely. And it breaks down by so many different levels, from socioeconomics to race. The Black population in the United States is extremely vulnerable to specific cancers, especially colon cancer, where rates are so much higher in both men and women. It's diagnosed later, it's more aggressive. And so, the need to gear preventions to that population is, very urgent. And at FCancer, we do that, but it's something that everyone should be focused on now. And then there's, a ton of different other types of disparities based on gender, and just different mortality issues. But I could go on and on this topic, but that's a, pretty good example.
Well, we'll certainly include resources below this video if people do want to learn more about those things. I'd like to bring in Dr. Christy Lamb, a psychiatrist out of California and one of our MedCircle doctors. Dr. Lamb, nice to see you for this first session here.
Good to see you as well. Thanks so much for having me.
When you said, Heather, at the top of this interview, how early detection is so important, it reminded me of my mother, who for years struggled with stomach aches and issues with food and all of these things. And she started taking Metamucil. and her symptoms improved. But my father was always so, I don't know, angry, I guess, because he wanted her to go see a doctor. And she said, I don't want to go see a doctor. I'm just going to take the Metamucil. And then by the years went by, and this went on. And then by the time she went to see a doctor, the doctor said, I wish you would have come in years ago because we might have been able to do something. His exact words might have been, we could have done something. So I understand what happens when people don't take that early prevention. But such a big part of that, I think, is being scared to know the truth. Dr. Lamb, what is your response to that?
Absolutely, Kyle. I had a similar experience with my own mother with breast cancer. She got the diagnosis and the doctors wanted to start treatment immediately. And she, I think, went into a bit of a freeze state and was even talking about her breast cancer had a really good prognosis with treatment. She waited about 6 months before even going back to the doctor. And my brother and I flew home to Florida and had a talk with her about the anxieties that were coming up and the fears of what will happen after treatment, what will I go through with radiation and chemo, and what will that look like for me, and is it worth it for me? And there's so many individualized decisions, and while so much of our medical technology and treatments in regard to cancer have advanced so much over the past even 10 years, let alone the last 50 years. But everybody has to make a decision for themselves and get clear about what's right for them, because it's not a perfect science. And so there's tons of anxiety about getting screened, and then once getting the diagnosis, to be able to then access care.
This might be a controversial question, but is it even our role as supporters to compassionately encourage someone to go get screened? Because, like you said, they're adults. They can do whatever they want. Why is it my business to tell my mother to do anything? I guess this question is for both of you. Dr. Lang, let's start with you.
So if I take off my clinician hat, right, because as Kyle, as you know, in my psychiatric practice, I am all about patient autonomy and people really being able to make the decisions that they need to make. For me as a daughter, it was really important for me to go to my mom and let her know how much I wanted her around, and how I was going to be there to support her in her treatment, and that she absolutely able to make the decision that she wanted to make, but that I had some strong feelings about her engaging in treatment, and that it was, being able to create that space that I have an opinion. I think that it is absolutely, you should be doing this. But I have to respect the fact that this is your choice. And in the later stages, when there were complications and another medication she could have tried, she chose not to because of the side effect profile. And, I had done a bunch of research and called friends who are surgeons to say, and they're like, absolutely, she should be on it. And she decided not to. And I said my piece and then respected the fact that this is her life to live, and that for her, those side effects weren't things that she wanted to deal with. And so it is, I think it's more than appropriate to share how we feel, share our opinions, and then also respect the fact that the person going through it is the only person who can be the expert in them and what's going to be the best path for them.
Heather, any additional thoughts?
It might be more controversial, but I agree with Dr. Lamb for sure. Once diagnosed and you're going through treatment, completely agree with patient autonomy. I think being an epidemiologist by training and looking at health from a public health lens, a community lens, there's so many reasons why I proselytize, get screened to everyone I know. I make them feel guilty if they don't. I push them to go get it. I say, for your family, for your kids, for your own health, if this gets diagnosed later, you're going to hate going to the doctor then even more than now. So you have to go. It's so important as a community that we push each other to do this. And then this sounds coarse, but from a economic perspective too, these screening tools save millions of dollars a year in our healthcare system, which is already so stressed. So it's so important on every single level, mostly humanity, to go get, screened.
Yeah. Hey, I appreciate a little controversy, Heather. So thanks for answering truthfully. I understand. Yeah. So I want to dive more into that. If we are going to encourage somebody to go get, like I get a colonoscopy every year because cancer runs in my family and I have Crohn's disease. But if I didn't get a colonoscopy every year, was that too much information for y'all? Then and my family was encouraging me to go get screened, there would be a very specific way I would want them to do it because I am particular. Have you found any best tools or practices on what is effective here?
I mean, on my angle, it's so individual. I mean, it really depends. Also, there's racial divides, there's economic divides. It's really like different depending on what population you're talking about. I mean, it's really almost an impossible question to ask because it's so individualized.
That's fair. Dr. Lamb, any best practices you can share with encouraging people to get screened or tested?
In my experience when I was working in family medicine, the biggest thing that I could provide was information to try and help understand what is the anxiety around this and how can I potentially provide all the rationale information that you might need to find the comfort in this, because, I think it's so clear that when we diagnose cancer early and get early intervention and early treatment, outcomes are exponentially better. And I think that there's lots of great compelling arguments, but it does depend on the individual and finding out what their barriers are so that you can then intervene appropriately for that individual.
And I would add to that too. I forgot to say this is depending on the population, you need to have someone who looks like you explaining this to you to really understand your experience. And it really, in research, you can see it is really shown that if you have people that come from the same community talking to you about this issue, they're more likely to go get screened.
Dr. Lamb, you've mentioned before that during COVID, obviously people weren't going in to get their normal mental health care treatment. Heather, I assume that the same thing was happening with screenings in the cancer world.
For sure. I mean, including myself, everyone put off their screenings. And the problem with that is, people then tried to get appointments and it was just backed up. So we're having people that either gave up or they're going so late that they're catching the cancer, much later, which unfortunately can translate to increased mortality.
I was excited to learn about the number of survivors that are now with us. Can you speak more to that?
Sure. I mean, the wonderful thing is research is producing amazing treatments right now. And we're living in that world where people are living after cancer or with cancer until they die of something else. But with that comes more survivors. So now we have about 17 million survivors, if we can quantify, but very little resources that are aimed at this population, very little information about fertility, about, grief and sex and survivorship. And, it's all very murky. So I do think kind of moving forward in this decade, we need to focus on that.
Yeah, that really is a good point. And hopefully this series can act as one of those resources. When it comes to the biggest issues that survivors face, could you give us maybe the top 2 or 3 and then some corresponding strategies to cope with those?
Dr. Lamb?
Yeah, Dr. Lamb, do that, please.
Absolutely. So on the mental health side of things, we certainly see a number of different symptoms that persist, even when people have gone into remission. So persistent anxiety around follow-up exams and follow-up lab work when they have had a clean scan and are going back in. This can be incredibly anxiety provoking. Also, when we're talking about cancer and surgery or chemo or radiation, the different types of treatment can leave people with their physical body changed. So surgery after a mastectomy, a woman or a man being able to feel comfortable in a new body, truly changed from the treatment that they've undergone. Some chronic pain issues are very common. And so it's so important that we build resources, just like FCancer is working to do for the survivor population. And that I think it's one of the things that is so incredible about this organization is that they really are working from prevention all the way through to how do we make sure that we're supporting people before there's even a diagnosis, and really that attention to a life changed by the treatment of cancer, even when the cancer has been alleviated.
Yeah. And I think a lot of people, when they become quote unquote survivors, if they want to classify themselves as that, during their cancer journey, a lot of people are around them giving them support. There's a meal train, there's people coming to visit and walk your dogs and all of that. But once you're, pronounced in remission or cured, that stops. And I think, as a person, you've changed completely throughout this process, and now you're left without that support system. So, again, I just think it's so important that we figure out a way to maintain that support throughout.
Yeah, I've heard that from a lot of people. They said, "Look, I got a lot of casseroles when I announced my diagnoses, and now it's a year and a half later, and there are no more casseroles, there are no more phone calls, and I need them. You
Yeah.
know, I need the support, perhaps now more than ever, because now I'm adjusting to my life. I'm adjusting to this normal." It's a great reminder for all of us that we can show up, and we should show up at all times when we can. Thank you.
We have a ton of resources, both that are functional, meaning we have a cancer care line where you can call and you get basically a quarterback of care to help you through the diagnosis, from second opinions to social support services, to help with payments, to everything like that. And that's completely free. And we're going to be expanding all of our resources in terms of life with and life post, which will include fun things, of course, about sex and grief and all of that dirty stuff.
Yeah. Yeah. Well, some of that dirty stuff we're going to be getting into in this series. If you're watching this prior to November 30th, 2021, you can join us on that day right here on YouTube to raise money for FCancer. We're raising money for FCancer to be used primarily to help those who are in need to get screened, to get those preventative measures in place. And you can find the details of that fundraiser at the bottom of this video. And if you're watching this after November 30th, 2021, you can still go donate to FCancer. We'll put a link right down there, and your money is still good. Okay. Dr. Lamb and Heather, thank you both for being here. Heather, what's the one thing you wish everybody knew about cancer?
Well, it might be a little longer than you want, but with COVID, we're seeing a huge decrease in screening rates right now, and late diagnoses, which turn into increased mortality. So get screened, talk to your doctor about the calendar of what you're supposed to do, and just get off your butt and go do it.
We are joined by triple board certified forensic and neuropsychologist, Dr. Judy Ho. Dr. Judy, welcome to MedCircle, and thank you for sharing your expertise on this topic.
Hi, Kyle. Thank you so much for having me on this very important topic.
I want to start with something personal to see how you have been impacted by cancer, because everybody this day has.
That's right. And both of my grandmothers, actually, my paternal grandmother and my maternal grandmother, passed away from cancer. My maternal grandmother passed away from essentially a kidney cancer that had then metastasized. So the complications of that is what she passed away from. And then my paternal grandmother passed away from a very sadly, quickly escalating ovarian cancer. So by the time she was diagnosed, she only had a couple of months left to live. So we lost her very early. With my maternal grandmother, we had a little bit more time with her, but we had thought that perhaps they had eradicated the cancer. She was in remission, and then it came back with a vengeance, and then we were never able to get her back after that.
Thank you for sharing that part of your life with our viewers. I'm sure a lot of people can relate to that. What are some of the mental health impacts that you've seen when people get that cancer diagnosis?
Well, it's really difficult because I think part of the beauty and the whimsicalness of human life is that people don't really have this idea of when their life is going to end, right? It's sort of everybody's timeline is essentially up in the air. You don't know how much time you're going to have on this earth. And I think most people probably hope that they have more time than less time. When you get a cancer diagnosis, you have these discussions about survivability and what is the likelihood of you surviving the cancer. And people start talking in months and years of how much time you might have life. That can be extremely scary for someone to contemplate, especially when they feel like there's a ticking time bomb, essentially, of how much time they have left on this earth.
When people get that initial diagnosis, what I hear is they say, I was really just in shock. Even if it runs in their family, even if they thought it was a possibility or probability, they say, I'm in shock. What is that a normal, typical response to this?
Absolutely. And I think that the reason why people are in shock is because it is such a drastic change to the thoughts and the plans that they've had for their own life, both short-term and long-term. And that's what makes it hard to accept. That's why it's shocking, because I think in general, people want to believe that good things are going to happen. So even if you know it runs in your family, you can't really put yourself in that position until it's actually being explicitly discussed as a reality.
Yeah. I remember in 8th grade, a girl in my class, mom died. And I remember she was gone for a week and then she was back at school. And I remember thinking, man, if that, I can't believe that happens to people. I can't believe other people have to go through that. And even in that moment, when it was so close to me, I never thought, oh, well, this might happen to me. And then 3 years later, the very same thing did. And so I can see how so much of us live in this world where we don't think it will happen to us and it won't happen to people we know. And when it does, that shock can lead to stress, anxiety, depression, major mental health issues. What is your advice as a psychologist on how to navigate the stress, the anxiety, the depression?
Well, first of all, be gentle with yourself. There's going to be nobody who deals with a diagnosis of cancer in the same way, and all of it is fine and all of it's valid. And sometimes people need some time to really process that, and that's okay too. You're not going to jump to acceptance right away, so don't expect yourself to. Expect that you're going to feel stress, anxiety, and depression. That's just going to be a very common occurrence. And if you weren't impacted in some way, I'd be worried that you completely shut yourself off from what's happening in reality. So really be gentle with yourself. It might be a time where you feel like you don't want to talk to anybody. I've heard from many patients that they just wanted to be isolating when they got the diagnosis, but this is when you need your community the most. And so reach out and ask for the things that you need, whether it's practical things or emotional support. Be honest about what you need at this time, and understand that the people who love you, they just want to be able to do something for you, and that whatever you ask, it's not going to be too much for them.
Certainly, people with a cancer diagnosis will grieve the life they were planning on living, or maybe even the quality of life they were expecting to have, in the near future. Dr. Judy has 2 fabulous series on grief available at medcircle.com or the links below this video. Right now, I'd like to provide an inside look into that series, so take a look at this.
Grief is a little bit different from depression, although having one doesn't really preclude you from having the other one. So grief is a normal process. It's a multifaceted process. It affects you at all levels. It can affect your work, your social functioning, activities of daily living, the way you feel about life, your outlook, your mood. And it can strike at very unexpected times. So you have that initial response when you first lose somebody, and then months will go by, you think that maybe you've healed from that loss, and all of a sudden you'll be so sad one day, you'll be crying and you're not sure why. And I think that that's what surprises people about grief. But that's very different from depression. They can feel similar, but there are some really key differences. For example, grief kind of comes more in waves. When you have a major depressive episode, it feels like you're depressed and sad and losing interest all the time. A lot of times when somebody is depressed, they start to have low self-worth, they feel bad about themselves, they feel guilty, they have lower self-esteem than usual. In grief, that's usually preserved. They feel okay about themselves. It's just that they're really sad, and they may even feel hopeless about life or start to deal with their own existential crises. And I think grief is also so much more punctuated. So as I mentioned before, it can come kind of in different times, whereas major depressive disorder, you have these symptoms very continually, and they tend to be pretty persistent, occurring most of the day, almost all days. And grief is not like that. Sometimes you have 2 or 3 bad days and then kind of feel like you're okay again, and then you have another day or 2 that's bad.
You can watch that full series on grief using the links below this video. Right now, I'd love to add someone to the conversation, somebody I know very well. And if you're a MedCircle member, you've probably emailed with her. Her name is Mandy, and she is the head of Mem Support and Partnerships. Mandy, wonderful to see you. Hi, Mandy. Welcome.
Hi, how are you?
I'm doing great. Mandy, I don't know if people know your history, so I'll let you share your experience living with cancer.
I found out in 2006, about 2 days after I found out I was pregnant with our second child, that I had cervical cancer. And that was a very scary experience at the time. I was young. I was not expecting anything like that, especially not in conjunction with such exciting news.
Mm.
And it became very clear that I had to make a decision on whether to keep the child or not, because they weren't really sure if the cancer was going to progress and affect the baby, if it was going to progress through my body. And obviously, you couldn't undergo treatment during that time. As we alluded to earlier, I was definitely in shock. I kind of probably was in denial. I call it naive faith. And I chose to proceed with the pregnancy. And most of my treatment was done after he was born. I was very, very blessed that things turned out well. But it was very emotionally challenging, and it was a huge struggle to go through something like that.
I really can't imagine. I cannot imagine all of that all at the same time. What worked for you during that time?
There was, I know it sounds cheesy, but hoping, like knowing that it was going to be okay in the end, even if I didn't know that. Just kind of trying to believe that, even if that didn't turn out well for me, knowing that my family would likely be taken care of. We would take the measures in the meantime to do what we needed to do. That really got me through. I hit a very, very low point. I was very depressed, very, very sick. And I just got to a point where I was so angry. And I
Mm.
kept asking myself, why are you so angry? I mean, aside from the obvious, but it really came down to, I miss my old life. I wanted things the way they were and the way I thought they were going to be and play out. And once I came to terms with that and accepting that, I kind of got a little defiant, was like, well, who knows? It doesn't mean that like life needs to kind of suck from here on out. So I just started focusing on what can I do to move forward to make this the best situation it can be, and kind of accept that I don't really know what the outcome is going to be, but all I can do is try what feels right at the time.
You said naive faith, which I kind of really like that, those two words going together. Dr. Judy, I've heard people say, when you get that cancer diagnosis, you need to buckle down, get educated, be in there, fight, but be realistic. And I've also heard people say, when you get a cancer diagnosis, you handle it however you can. Okay. There is no one way to do this. What are your thoughts on having naive faith when it comes to something so big like this?
Well, I really love what Mandy said as well, because the research really does bear out, and you see it in clinical settings all the time as well, that people who have that holding on to hope attitude, well, I'm going to be the one who beats it, even if the statistics don't look good. They do end up having better cancer remission outcomes. It's just something that has bore out in the literature for decades. And there is something about that, because if you believe that there's hope for recovery, you are going to take more personal responsibility to do the things that you can, as you mentioned, Kyle, to get educated, to explore all of the different treatments that might be available, and to not give up, essentially. Even if one treatment doesn't work, let's try the next one. That is a really, really important part of making sure that the cancer outcomes are as positive as they can be. So we've seen things in research where people are more likely to go into remission, that they have more survivability in general, that they have more time than the doctors had initially said. All of these types of outcomes are associated with a more positive attitude, as well as that attitude being linked to personal agency to improve your health outcomes.
Mandy, I've talked to you outside of MedCircle. I remember you saying that you hit a wall during this journey. When you hit that wall, which understandably so, when you hit that wall, what did you do to move forward?
I call I call that kind of guinea pig syndrome. Like you get to a point where you're so tired of being tested and poked and prodded and hearing statistics and what your options are, and it can be overwhelming. And while it's geared to inform you and inform decisions, it can be too much sometimes. So I would really try and take a step back. I would communicate with my family. because one of my grandmothers chose not to get treatment for her cancer. And my family was very angry with her for a very long time because they didn't want to lose her. But for her, it wasn't right. And like Dr. Judy said, there is no right way, textbook way to approach this. And I would tell my family, like, I'm weighing my options right now and just trying to choose what feels right for me. And so I would just take breaks and just go have fun or enjoy like the things that life was supposed to be about, that I just wanted to soak in. And that really also helped perpetuate more optimism moving forward as well.
Really well said, Mandy. It's always good to see you, and thank you for coming on MedCircle, the platform that you work so hard and tirelessly on. Thank you for everything you do for MedCircle. You're just fabulous, fabulous, fabulous.
Thank you.
Dr. Judy, it goes without saying that taking care of your physical health during this crucial time is super important, but I have read that not enough people, so to speak, are taking care of their mental health when they get this diagnosis. What are some of the ways that people can do that?
Well, lots of rest, making sure that you give your body time to heal and give your body the best chance for healing. And a lot of that is learning to be more still and embracing the moment, practicing mindfulness, doing all of the things that help both your mental and your physical health. And so I think it's really important that people just take a step back, allow themselves to take the time that they need to process this information, take a break from work, get with your community, get good sleep, eat well, do all the things that you can to really take care of your physical body and also your mentality, really, in dealing with all of this. I also think that it's really important to think about something bigger than yourself. I think when people grapple with these issues of mortality, really the existential crisis comes in very quickly. What is the impact that I've left on this earth if this doesn't work out for me? What does life mean now if I only really have a few months left? Like, what does that mean? And I think whether or not you believe in a higher power, it's less about that, because it can be very much not even believing in something that you would call God, but maybe just understanding that there's something bigger than yourself. For a lot of people, spirituality is found in nature, being in the elements, taking walks, going on hikes, sitting in front of an ocean or a lake. And it helps people to really invoke that part of themselves that realizes that there is something bigger than themselves, and that actually can help to seed hope when people are feeling hopeless. And I think that that's really important. Really getting aligned with your values again, right? We always talk about values-based living, and I think there's nothing more real than trying to tap into your values when you are faced with an existential crisis. If you only have a few months left, like, how do you want each day to look?
Yeah. Wow.
What do you really want to do with the time that you have left?
Right.
Love the people that are the most important to you. Spend time with the people that you cherish the most. Nobody is on their deathbed thinking about all their accomplishments in life. They're thinking about relationships, the beautiful memories they've had with people in their lives. And so really thinking about how you want to spend each day and live each day, take control of each moment and do the things that really mean something to you. And of course, the byproduct of that is people who do that tend to have better outcomes in terms of cancer remission, in terms of cancer recovery. And the more you can get into professional mental health care during this time is also really important. Research has shown that when people receive proper mental health care, they also have better cancer outcomes, and they actually receive more optimal treatment for their cancer diagnosis, because I think people feel more empowered to ask for the things that they want from their doctors.
That's all really wonderful advice too, to the supporters out there who maybe seen somebody they love dearly really struggle, and it starts to cause them to start questioning their own mortality and how they want their lives to look. And I think it's a great reminder, no matter where we are in our life, to know that each day we do have some control and some decisions that we can make to structure the day that we want. And life is certainly just a series of days. So it is a great reminder. Thank you, Dr. Judy. I will make sure that we link to some additional resources below this video. But is there anything that you want to touch when it comes to the overall umbrella of cancer and mental health?
Yeah, I think part of this is all about perseverance and not giving up. Doctors are amazing people. They've dedicated their lives to helping people overcome all different kinds of physical ailments, but doctors can be wrong. When they tell you something, it's based on oftentimes statistics and what they know from research and experience, but there's always the person who beats the statistic. And why can't that person be you, right? And we know that if you have that mentality, it actually then ends up translating to better outcomes for all kinds of physical ailments, not just cancer, but all kinds of chronic illnesses. So don't give up. And you can be realistic, that's fine, but also be hopeful. Be hopeful that you could have a better outcome. And really lean into your community. I know that you mentioned you're going to link to some of these resources, but some great communities include cancersupportcommunity.org. They actually have locations all over, and it's a 3-part program that focuses on direct service delivery and research and advocacy. And there's a lot of support groups that are run by this parent organization. There's also a lot of great information on cancer.org. They also have a number of local cancer support programs. So definitely tap into that, whether you're a family member supporting somebody who has a cancer diagnosis, or you are someone who was just diagnosed with cancer yourself. And also, even when you're a cancer survivor, sometimes people think, okay, we're at the tail end of this. I've been told that this is going into remission or this is improving. The work doesn't really stop there. I think once the crisis is over, sometimes that's when people start to feel that depression and anxiety. It's like, now that the actual crisis is over, now you're actually processing it and you realize you have some post-traumatic stress about it. So definitely make sure you still reach out to these communities and get the mental health support that you need.
Fabulous. Thank you so much, Dr. Judy. In this session, we're going to talk about the physical experience of cancer and its implications with mental health. I have a fabulous guest to discuss just that. Dr. Peled is here. Now, Dr. Peled, it's what's so impactful about you is that you're not only a surgical oncologist, but you're also a breast cancer survivor. Thank you for coming on here. And can you share a little bit of your story?
Yeah, for sure. Thanks for having me. So I am a breast cancer surgeon. I'm also a breast reconstruction surgeon, and was incredibly surprised almost 4 years ago to be diagnosed with breast cancer at 37. Had no family history, really active, was really stunned, I think like everyone is. But honestly, it's really changed for me the experience that I have with my patients. I feel like I better understand what it's like to get a diagnosis, what it's like to go through different steps of treatment, and also to really understand the physical, the emotional, the mental health aspects of the diagnosis and the treatment. So I'm really grateful in some ways for that experience to be able to connect with patients better.
Yeah, I can't imagine someone more qualified to kind of handhold somebody through this experience. No question that everyone's experience is unique, both from the physical experience and the mental health implications. Why is it so important for us to remember this? And then in the same breath, what are some of the more common experiences you've seen, or maybe you've experienced yourself when you were going through that journey?
So I think the first thing to think about is that breast cancer is really common. So 1 in 8 women in this country get breast cancer. And when you think of it, that means that most everyone is going to know someone who got diagnosed with breast cancer. So I think it's incredibly important to keep in mind that everyone's journey is different. Like you said, treatments are going to be different. And so when you're thinking about what's going to happen to you, sometimes it can be really scary to hear someone else's experience that may be nothing like what yours is going to be. So I think first off, kind of letting yourself have that space to know your journey is different is incredibly important. But some of the consistent things we see, I think one of the first ones is just that feeling of how disruptive cancer treatment is. Yeah. And I know for me, I got diagnosed, I had 3 little kids, I had a whole bunch of teaching. I do a lot of teaching across the country to other surgeons how to do kind of breast cancer techniques. And I sat there thinking, how am I going to tell my kids, and what does it mean for my practice and my teaching? And so I think giving yourself that space to really appreciate and honestly grieve how disruptive it's going to be in your life is incredibly important, because a lot of people just kind of push through that, and you need some time to appreciate that. One of the other things we see is that fatigue is a pretty common part of all the different parts of breast cancer treatment. So whether you're having surgery, radiation, chemotherapy, hormone therapy, fatigue is a big issue for many people. And trying to figure out for you what helps you get past that fatigue. For me personally, it's actually exercising. So exercise is a huge part has been of my recovery and of my daily life. But for some people, that's not it. For some, it's time with family. It's making space for downtime. But appreciating the fatigue that's very real is another one, and giving yourself the space to be tired and feel okay with that, but then also try to do something about it.
When you were experiencing your diagnosis, or when you first were diagnosed, rather, when did you tell your kids and how did you tell them?
So I'm going to be honest, I actually never told my kids. So
They still don't know right now.
They still don't know right now. No, I
Wow.
suspect I've actually been pretty vocal about my experience because I think it's really important for people to hear young women talking about getting cancer, to not ignore breast lumps. And my son's 10 now, my oldest, and he probably knows because they do enough of it. But for me personally, I felt very lucky in that I had stage 1 breast cancer. I didn't need chemotherapy. I had a surgery that was relatively straightforward, so I was able to come back to my family. But, I think for many people, that conversation with kids, a lot of it is really just being honest and really talking about, what is going to happen, so that when kids see people losing their hair, coming back tired, not being able to snuggle, that they know that that's part of the process. So I've certainly helped many people through, and will certainly tell my kids at some point, but feel lucky that for them, it wasn't particularly disruptive, even though it was for me.
Sure. Wow. I experienced something very similar, but from the child side. When I was 13, my brother was 10. My dad told us, your mom has cancer and we're going to go fight it. And we said, okay. And off she went, fighting the battle. Well, I don't know when exactly I was told or when I started to believe. I don't really have a recollection, but I got the sense that the cancer was done. It was gone. And my mom was just going through extra safety precautions to make sure it doesn't come back. And I was at a retreat of some kind for school. I was in high school, and by this point I was 16 years old or 15. And we were doing this, activity, and it made me reflect on my family. And I thought, oh my gosh, they told me that she is not sick, but all of the signs and evidence point to that she is. I'm not 13 anymore. I'm 16, And I remember calling my mom. I was crying, and I go, are you still sick? And she goes, yeah, I am. And I said, well, why didn't you tell me? She goes, well, we didn't not tell you. We just kind of kept our life going, And I never had any ill will towards it. I was never angry about it, because as I was older too, I realized, man, however you need to handle this is also fine with me, and what I can do in this tiny role that I have as your son is just say, okay, well, thank you for telling me now. And, let's keep going. So thanks for saying that.
It's pretty remarkable though, to get to a point where you can appreciate that as a parent, because honestly, as a parent, all we're thinking about, right, is how to not disrupt our kids' lives as well. And that balance when you're sick, you have all those physical, those emotional distress that comes with all of that. And then on top of that, these people that you love so deeply, that you spent all of their life trying to do everything you can to protect, trying to also manage that. It's really hard. Part of it is really tricky. And I know with my kids, one of their friends' grandparents had just died of lung cancer right before my diagnosis. And I just knew that even the word was gonna send them to a totally different place than, fortunately, where my breast cancer staging was, and all those nuances and the ways that we think about it is really important.
Yeah, really well said. And I'm glad we've brought that up too. I think a lot of parents will watch this, and they will have lots of different people, lots of different parents will do lots of different, choose lots of different pathways in bringing their kids involved. Some people are super transparent. You're coming with me, and I don't know if there's a right or wrong way here, because it's all so unique. So I think giving some grace in that area is really nice. What do you tell patients who are experiencing physical side effects and also may be suffering from the mental health impacts?
So I love that you very clearly acknowledge that physical impact leads to mental health impact. Because I think just the fact that we even talk about that is so important, because it really does. Chronic pain, chronic side effects, those things, especially in the midst of a cancer diagnosis, which is already fraught with a lot of mental health and emotional health challenges, I think is incredibly important. One of the first things I say is kind of don't be home suffering by yourself. And I see this, I really get from a patient physician side. I see patients of mine and they will tell me some things about side effects of medications that I'm not prescribing. And I'll say, oh, did you tell, your doctor who prescribed it? No, I didn't want to bother them. I say, that's our job. Our job is to be here. So I would say the first thing is really talk with your providers about your side effects, because a lot of them we can manage really well. Not all of them, but a lot of them we can. But if you don't ask, we don't have the opportunity to switch you to a different one or suggest some things that might help. So that's kind of my first thought about that. And then the other one, I think that can be helpful for some people. Again, everyone's journey is different, but I know I'm very involved in talking about some of the ways that I manage my own side effects of medications that I take in a pretty open forum with other young women who've gone through breast cancer. And I personally find sharing what helps to be really impactful for me and feels really good to be out there doing it. And I also love hearing what other women are doing. And I do think that that's a great space. If being open in that kind of community is helpful for you, people have really great advice. You feel supported, you feel heard, and it makes that feeling of being alone with your crazy side effects that turns out they're not crazy. I think that makes a big difference.
My friend is going through IVF, and she has become part of so many online support groups with other women going through the same thing. And she said, look, I love my doctor team. They are fabulous. But so much of this journey has been about that support community, and not just for them to say, you're doing great, or it's all going to be okay, or whatever they're saying. They're saying, oh my God, is anyone else leg on fire when they do this injection? Everyone's like, yeah, my leg's on fire. What's that? It's just, I totally get that. But so talk about, if you're comfortable, some of the strategies that you implemented when going through your treatment.
So I mentioned exercise a little bit, and we know that the data on exercise preventing recurrence are so strong. Exercise dramatically reduces the chance that cancer comes back. So for me,
what is that? I don't have to push you for an actual number here, but when you say dramatically, what is dramatic to me?
30 to 40% in some studies. I mean,
that is really dramatic.
Really dramatic. Not just
not to be dramatic, but that is really dramatic. Yeah, 30, 40%. But how much exercise are we talking here? Because I don't like exercise that much.
30 minutes, 5 times a week. And it doesn't have to be crazy. That's moderate walking. That counts. And so that's the thing I think is so good for people to hear, because one of the things we talked about, giving yourself grace in these situations, you're going through cancer treatment, you are having side effects of medications, but you're being told you need to be a healthy weight. You're being told you need to eat well. People think they need to stop having sugar or alcohol, and they need to exercise all the time. And that is so hard to manage all of that when you're also just trying to get through cancer treatment. So what I tell, again, it comes back to giving yourself grace, which is that if you think about the fact that exercise is good for you, you think about the fact that exercise helps with side effects, but you also know that you do what your body can handle in that time. So I have friends of mine who gained a ton of weight during chemo. They're really sad that they couldn't exercise, but we talked about it, and that was the stage they were in then. They got through their chemo, they healed, and now they exercise regularly and feel great. So you have to give yourself some grace in that. But we do know that exercise helps with a ton of side effects. It helps with physical side effects. So things like joint pain, fatigue, bone pain, muscle pain, those are all really helped significantly by exercise. But the other thing is that we know that cancer-related depression and other mental health issues are also helped by exercise. So in my mind, it's kind of magical. I also like to use it as a great time to exercise with other people. So being part of an exercise community, then you also get that feeling, which also helps from a mental health standpoint of being part of a community of people committed to exercising. So in my mind, that's one of my favorite ones to prescribe, if you will, both for myself and for others. And then I think the other one that I like to think about a lot is focusing on active things I can do rather than focusing on things I shouldn't or can't do. So alcohol is a great example. And I see women come into my practice, they're diagnosed, and they come in there, I stopped drinking altogether. Like breast cancer is associated with alcohol leads to breast cancer, I stopped drinking. But we know from data that you don't have to stop drinking if you don't want to. It's moderate alcohol. So we talk 3 to 4 drinks a week is okay, even if you've had breast cancer. And for me, my husband loves to make cocktails, and it's like part of our Thursday and Friday afternoons, and we get together when I get home from work, and it's a really great part of my week to have that time with him. So there's no reason I'm going to take that off the table for myself, knowing that that's only kind of a moderate risk. So instead, I think about it as a proactive thing. Here I am doing this thing. It makes me feel good. It's something I look forward to. It's family time, as opposed to, oh no, I can't have this. I can't have that, and make it a negative thing. And similarly with eating, rainbow diet. We all know we should be doing it, but make it fun, make it exciting. Like, how great of a, salad with salmon can you make, and make it fun, as opposed to, oh, I can't have any carbs or any sugar. And I think those do make a big difference from a physical and a mental health standpoint.
What about cannabis?
So I also regularly take cannabis products to help with my management of my symptoms. And I think it's something that I wish more people talked about, because we have data on that also. And I'm not quite sure why there's still stigma around it this far out with how much data we have. So that's something that I often, when I'm in forums, will talk to people about. For me, it's made a huge difference with sleep and some of the side effects I have from my hormone blocking medication I take at night. So I love that you ask about it, and something I try to talk about regularly too.
What do you say to the patient, the person coming into your office and says, I was on Reddit last night at 2:30 in the morning, and I did a deep dive, and there is this person in another country that says if I juice, I'm making this up, y'all, this is not true, if I juice celery and broccoli and drink it 3 times a day, this person cured their cancer, I can too. Doctor, why don't we do that?
Happens all the time. And I think acknowledging, though, that there is a psychological component to treating medical problems is important, right? So one way you can handle that is just to say, like, no, it's not true, don't do it, and be done, and just be dismissive. The other thing you can think about, though, is how do you support people bringing things into their life that feel like they're going to have a positive impact while still getting standard treatment. Yeah. And so that's the key. When we talk about alternative therapies, I really prefer the term complementary therapies. So nice. You're doing your standard treatments, but you're adding things on that you believe work or that may add. And a lot of those do have benefits, but we got to still stick with the things that we know when we're talking about cancer, that's life or death, that do make a difference.
As an oncologist, were you mindful about attempting to prevent breast cancer in yourself?
Breast cancer prevention is tricky. And I think this is another one that I see a lot of people come in and they say, like, what did I do wrong? What wasn't I doing? Or I drank too much, or I took birth control pills, or I did this. And it's so multifactorial that the reality is, when you look at all the risk factors for breast cancer, I didn't have any of them. I was doing like all the right things. I would say, like, it's my blog title of, you can be a 37-year-old vegetarian triathlete breast cancer surgeon and still get breast cancer. And it's a real thing. It happens.
Yes. Good for you.
But so again, like, all I can do now, it happened. It's where I am. And all I can do is I can do the things I need to stay healthy. I can stay positive about the fact that, I get to wake up every day, have this amazing job, go out there, talk to people about the fact that you can get through cancer treatment. And then you can use this as an opportunity. So when I see people who do come in and maybe they're not making the best choices for their health, but they're diagnosed with a small treatable breast cancer, it's so fun seeing people coming back and saying, like, oh, I quit my crazy stressful job, or now I sleep 7 hours a night, or I lost 50 pounds. And that doesn't mean that all those things made you get breast cancer, but you can use this as an opportunity to make some changes in your life that are positive across the board, not just from a cancer standpoint.
What about the person who says, well, then I'm just going to eat brownies and watch Netflix, and I don't care if it runs in my family because I'm going to get it. So I'm just going to live how I want to live.
Yep. And we totally see that as well. And I think that's a fun place to arm people with data. So the reality is, like, breast cancer is a great example. We're really lucky now that breast cancer is highly treatable. So stage 1 breast cancer has a 95 to 99% survival rate. So if you do the things that help you, if you're going to get cancer, it gets picked up sooner, you're doing screenings, you're being on top of your exams, then you could be in that very high chance of survival, as opposed to people who might present at a later stage and aren't doing that. So that's where I like to use data to tell people, look, you can be proactive. You aren't just going to sit there and wait to get cancer. You can do something about it, and we can detect it early if it's going to come.
Doctor, finally, you're an oncologist, you're a survivor. What's the one piece of advice that you have that you would like to share that really drives home your mission?
Know your options and advocate for yourself. And I think until I was in the position of a patient, I don't know that I really understood that you don't necessarily get access to everything that's out there. You're not always told about the latest treatments. And unfortunately, a lot of times people offer you what they know and what they have access to.
Yeah.
So, in our practice, as a result of my breast cancer surgery, we've developed some really neat new techniques to help with quality of life after breast cancer surgery that I didn't have personally. But if you went to see someone else who doesn't offer those, you would never even be told about them. So I see people all over the country every day who they're just given a very narrow window of what they could have. And so trying to educate yourself, don't get lost in the world that is cancer or online information, but try to find your community of people, see what else people are doing, and really educate yourself. Get that second opinion, get that third opinion, because ultimately you're the only person that wakes up in your body every day. Yeah. So it doesn't matter what any of us as healthcare providers think. It's you, your body, your family, your world, your life. And it's okay to advocate for yourself. It doesn't make you a bad patient. It doesn't make you a high maintenance patient. It makes you a person who understands that their life and their body matter most.
We briefly mentioned the process of grief during a cancer diagnosis and treatment. In this session, we're going to dive further into that topic and also hear from somebody that you likely have not met, at least not here on MedCircle, Lauren Tarpley. Lauren, welcome to MedCircle, and thank you for being here.
Hi, thank you for having me.
Absolutely. We'll be joined by Dr. Ramani in just a little bit, but I wanted you to share your experience and your story briefly with our viewers today.
Sure. I was diagnosed at the age of 34 with stage 2 breast cancer. That puts me in the AYA category. That's a young adult and adolescent cancer. And my cancer was found by a routine mammogram screening and with self-exams. I've since completed treatment, 6 rounds of THCP chemo, 11 rounds of immunotherapy, 25 rounds of radiation, and I'm about 4 surgeries in and about 2 to go. So
incredible.
Little snippet.
One snippet of many. And I'm so thankful that you're not only able and willing to come on our show and talk about this, but you've also spread this message through your book that was just released this summer, Type A Guide to Cancer. We'll link to it at the bottom of this video, but why don't you give us a brief overview of what's included in that book?
Sure. So I wrote this book with the point of view of this is the book that I would have liked to have when I was diagnosed.
Yeah.
It goes through my personal journey as well as almost the usual standard of treatment with someone who is diagnosed with HER2 positive, who is not hormone receptive, who is not BRCA negative. So we go through diagnosis, chemo, all of the treatment, but I also touch on racial disparities in medicine, as well as grants that are available for cancer treatments and people who have recently turned into survivors to fill those financial disparities and those gaps that short-term disability or job displacement would cause. And so it's literally a guide. It has questions to ask your doctors. There's a notebook in the back for you to take notes. It also has tips and tricks to get through treatment and things you would need before, during, and after treatment, surgery, things like that. We also touch on caretakers. And so it's just, even with the world at your fingertips on a computer and all the information you could possibly want, you're still kind of lost when you're diagnosed. And that was the motivation.
Really well said. When you were first diagnosed, did you feel yourself move into that state of grief, or were you feeling other emotions like frustration or maybe even being scared?
I think it was immediate shock, then followed by being completely lost, and then a slippery slope into grief. I think that personally, every milestone I hit was grief and then acceptance. It wasn't all the steps for the whole process. There were each of the steps for each step of the process.
Yeah.
So the diagnosis, I had to grieve that. I had to celebrate that. I had to accept that. Treatment, I had to grieve the loss of time. I had to grieve the loss of my hair. I had to grieve the loss of my abilities to exercise, to play with my son. So specifically that. And I think that once I learned how to process my emotions that worked best for me, that is where I got to a more mentally healthy place.
Wow. First of all, I know I said this earlier, but really well said and very, very honest. I really appreciate that. I can already assume that Dr. Ramani is nodding her head in agreement. Dr. Ramani is a clinical psychologist, a MedCircle certified educator. I'd love to welcome her on the show now. Dr. Ramani, we all have an experience with cancer, even if ourselves have not gone through it. If you're comfortable, I would love to know where in your life you've been affected by a cancer diagnosis.
So many ways. And first of all, Lauren, you tell your story so eloquently, and I'm already thinking about, we've got to post about her book and share her book and let the world know about your book. So we got you. We want to make sure people hear about that. So thank you. So many ways, Kyle. I lost an uncle to cancer. My grandmother developed an oral cancer, and even which, for much of her life then affected her face and her ability to speak. And so, I mean, that's within the family. I have a dear friend who had to have a radical bilateral mastectomy, and it was real touch and go with her. So I agree with you, Kyle. I don't know of a person out there who hasn't been affected by cancer. Either they have lived experience, or they were a supporter, or have lost someone dear to them.
One interesting thing that Lauren said was that she processed grief at every step of the way. She had to do those steps every step of the way. And I think a lot of people think grief is supposed to go in an order. As a clinical psychologist, is there a way we're supposed to grieve?
Absolutely not. In fact, I often try to pull people away from a stages model because they're sort of waiting for things to unfold. Some people, they will be hit with, they start with anger, like they're right in there, and then they stay in anger for a while, and and then there's all these other pieces to it, right? There's regret, there's rumination, there's confusion, there is, so it's not stages. And I think if people wait for stages, the danger to stages to me is that if people are waiting for these to go through in stages and those stages don't show up, they feel like they're going to be stuck, or they're almost not doing it right. And a grieved person is a fragile person. And so they may even say, I can't even grieve right. Well, there is no right way to grieve. It's to understand that time in many ways is your friend, and to also talk to people about it. But for everyone, time isn't, not everyone is time their friend. It gets complicated. For some people, there are, I think in Lauren's story, something that's so compelling is she has a son. And so you're not just grieving for yourself, you're grieving for your son. And Lauren was in the thick of it. I don't want to speak for you, but there's a moment in every cancer survivor's journey where they really have to look mortality straight on. And when it's somebody young, it's not just your grief. It's imagining your child having to process the loss of a parent. And so I think that it's the grief around a severe illness diagnosis is so complex and so nuanced, and really people have to sit with it, look into the abyss, to come back from the abyss, have a new body, all of that it is, and it's an ongoing process. It's also one that's never done. What I love about Lauren's story and what she's done, and she really reminds us of that final stage of grief, which is meaning and purpose. We always think it's the train stops at acceptance. I'm like, no, there's one more station. And that for her, there was a profundity to the meaning and purpose part of Lauren's journey, in that she wrote a book. And she's paying it forward. Now, some people might say, well, I'm not writing a book. Does that mean I didn't have meaning and purpose? Not at all. For some people, it means that they say, you know what? I'm pulling back from my job. I'm spending more time with my family. I'm going to volunteer in something that may not even have anything to do with cancer. I'm going to take a walk each day and smell the flowers. All of that is meaning and purpose oriented work. It doesn't have to be on as grand and amazing a scale as what Lauren does. Even if all a person does it says, today I'm going to go and water those plants. Great. You know, because life feels like such a blessing at that point, but it's a journey to get there. And I want to say one more thing about this. And Lauren, I'd love to hear your experience with this too, because someone very dear to me who lived through a cancer diagnosis and treatment said, I'm really tired of people telling me to hurry up and find strength and cheer up and tell me all their cancer survivor friend stories. She said, I'm angry and I'm upset and I don't want to hear that right now. So keep your positivity to yourself. And I do think it's very important that we're sometimes scared when somebody comes to us and tells us they have, for example, a cancer diagnosis and we want to make it better. And I apologize, but what we have to keep in mind is that we need to meet someone where they're at and we don't need them to cheer us up. So Lauren, did you ever have that experience where people are like, okay, Lauren, be strong. And they were almost trying to tell you, be positive and that's going to heal your cancer?
100% every single day, even this week. So I think I'm a rather positive person. To your point earlier, healing and grieving and even the steps aren't linear. It's not even a progression. It's all over. It's a squiggly line graph. That toxic positivity, it comes in all the time. And everybody's got to find their inner strength and, their reason for being and through treatment and find their motivation through treatment themselves. You can't even list all these people that you've seen gone through it and what helped them. That may deter them. I definitely experienced that. And, personally, my anger just came in way at the end. I never asked why until it got to infection, this subsequent surgery, that. When my doctor looked me in the face and told me, give me 12 to 14 months and you're going to be done. That is how my brain works. I loved the timeline and I said, okay, whatever it takes for this amount of time. Then when we got to about 13 and a half months and that timeline was a little derailed, it's like, I did my part. You threw all your chips in, I threw all my chips in. I threw my hair in, I threw my body in. Like I did everything plus what you asked. And now we've got infections and complications and, radiation. It's just like cancer. Cancer looks at all the rules and it throws the book away. Radiation looks at all the rules, it laughs, it throws the book away. It changes the game. And so my anger didn't even come in until the very, very end. And then that's when, giving up and hopelessness kind of kicked in. And then you've got people that are like, you're so far, you're technically cancer free, you can do this. And it's like, I don't know what I can do. So you definitely don't know what I can do. And after you've had to, again, to your point earlier, stare mortality in the face at 34, and you look at your son playing, so energetically when you have literally no energy with your parents or your sister or your husband. And then it's an out of body experience. You kind of see them playing without you and you're like, okay, well, they can do this without me. And that's kind of disheartening too. It's like, oh, well, then what am I fighting for if they're all doing great? It was just an out of body experience. And that was kind of demotivating too. And you're kind of looking at this like, I'm so lucky. I'm so fortunate to have a husband, to have a son, to have them in the best possible situation. But then I'm over here just having an emotional outburst because I've had an out of body experience and I'm picturing them playing, totally forgetting about me. Like some of these things are really irrational. And again, it's just not linear and you don't know when these feelings are going to pop up. But that toxic positivity it's a tough one. And that one hits hard. Yeah.
And Dr. Romney, please continue to jump in and ask questions. I always love to hear your insight. But Lauren, what was the most surprising thing during those 14 months or even after that?
I would say maybe the mental resolve. So when I was diagnosed, I felt betrayed. They asked me so many questions. How much do you drink? Do you do
illegal drugs. Have you had this? Have you done this? We need to test you for, we need to do a PET scan, see if you have cancer anywhere else, see if it's spread. And, all of my answers were no. I'm, again, BRCA negative, hormone receptor negative. So when you're HER2 positive, your cells just kind of decided to do it. And that's kind of the scariest part, because they have no idea how they're fueled. They're fueled by the way your healthy cells are fueled. And so when I found out that there was something going on inside of me that was inexplicable, just ineffable, I felt betrayed by my body. But then going through treatment and seeing how much that I was doing to my body, when technically it was the cells that kind of went rogue, then I came around and I had resolve, and I was like, well, thank you. Thank you for supporting me through this journey, body. Thank you for bringing me to this point. And so I would say, kind of realizing how much you can do, getting treatment, still working out, going on walks, still being a mother, still having a full-time job. I worked all the way up until I had the double mastectomy. And the only time I took time off was after I was diagnosed for the modality and the diagnostics and things like that. And I took a couple of days off for IVF, but I worked all the way through all 6 THCP chemos. And I took the day before the double mastectomy off just to cook food to put in the freezer for my family. And so I took the 3 months for the double mastectomy, the healing, and radiation. And other than that, I've worked through every other surgery, every single one, failed or not. I've had a few failed reconstructive surgeries. That's what the surgery in 2 weeks coming up will be to fix. Again, radiation changes all the rules. So, I mean, blessed be anyone who had a, straightforward reconstruction. But yeah, so to answer your question, it's really just, that mental journey and that resolve, and just seeing how much the human body can take. I thought I learned that through childbirth, but that's nothing compared to that.
How insightful. Dr. Ramani, I see your reactions there. What are your comments on that?
Lauren, one question I have for you is, you said you worked all the way through. Did that help you, or was that exhausting for you? Like, how was that psychologically part of your process of having to work all the way through?
I think it definitely helped. I think it helped mentally. I think it helped with chemo brain. And I also think it helped, stave off depression. Because treatment is 8 hours every 3 weeks. The world keeps spinning. Xfinity still wants their payment. Like, everybody still wants to be paid. Like, my kid still needs to eat. You still have to have fun. I mean, that's kind of the way I approached this, right? Just with humor and humility, and just what's going to happen next. I had some people to consult that have been through it as an AYA cancer patient. But they weren't Black women. It's like where we had so many similarities, we had so many differences. But just to keep my brain and body busy, sometimes I wasn't Lauren with cancer. Sometimes I wasn't the friend with cancer, the friend that needed help, the friend that needed dinner. I wasn't that. I was just an employee. And I work in corporate social responsibility, and I work for a fantastic company, and they've been there for me since the minute I found out, because I found out in the middle of my workday. Wow. They still call you with that news. That's crazy. But they've been there every step of the way. And I realize how fortunate I am. That's, again, why I needed to bring this information to people, to realize that there are companies that will support you through this. It's something like 30% of women will lose their job after a diagnosis because of the amount of time they will need for modality, for diagnosis, for IVF, for treatment. If you have an hourly job and you're like, well, every 3 weeks I need a day off, and then you're going to need time to recover. Mine was on Thursdays. Fridays, you're on a steroid high. Saturday and Sunday, I had to sleep. Halfway through Monday, I was okay to work, right? So I would use that time to do correspondence or research or anything like that. And so they worked with me. But there are people that aren't that fortunate. But yeah, that if you're just stagnant and sitting there and thinking about, what is the treatment working? Is it not working? How poorly you feel, whether if you're able then just to push through and actually do it. For me personally, it really, really helped. Stay
Dr.
normal.
Ramadi, as a psychologist, we've talked about how people use work as a distraction, as a coping mechanism. In this case, how do you think people could leverage these types of day-to-day distractions while they're battling a diagnosis like this?
I think that's why I was so curious about her answer, because I think that, like Lauren said, in some ways this is sort of the best scenario because it was a supportive employer. I think that what happens is one of the biggest issues we have with people, especially those who are diagnosed with illnesses like cancer that are so sort of defining, is that there's a real danger of the identity becoming the illness. The person then is sort of like, it becomes Cancer Lauren, right? Instead of Lauren, who is a mother, Lauren, who is a wife, Lauren, who is working in her position, Lauren, the friend. And having those sorts of touchstones or benchmarks can actually be an incredible tool of health for people to be able to hold on to those identities. But I think though Lauren really, is intimating something so important. Not everyone is in a job that's either supportive or it could be physically demanding in a way that, they can't, it's not viable. And yet out of financial necessity, they need to work. So it's really that people find the things to do during the day, whether that's work, whether that's parenting, whether that's whatever else a person does.
Hey, but can it be just hanging out and watching TV?
Yeah. Mix, no, because I think that what ends up happening is it comes down to what a person is sensing, like, who am I? What am I about? This morning, in fact, I had a meeting with a colleague who if she has chemo the day before, she may or may not come to the meeting. She may step out, but I recognize she's such an important player in these meetings. And I wonder, and she's even said that this is actually important for me. This is the stuff of my heart. I love what I do here. And so when she comes, I'd imagine it means talking about something other than cancer. And I think one of the big issues that people who are living with an illness face is that that's all they get to talk about. And oftentimes that's all people ask them about, right? Like, how are you feeling? Or there's a lot of that, how are you feeling? Versus maybe she just had a really cool thing happen at work and we're missing that part of the conversation. It's not defining someone by the illness. That's an absolutely critical part of this. And I think that's why the working piece is important. But again, Lauren also brings up one of the big issues we have in this country. When you look at the intersectionality of race, gender, and socioeconomic status, those are the most vulnerable individuals who often don't have the healthcare support. And I'm really glad that Lauren brought up health disparities, because one thing we know is that people of color, especially Black people, Latino people, their medical symptomatology is often minimized in the medical establishment, meaning that the kinds of tests that might render early diagnosis and identification are often missed, meaning that people from these ethnic groups, racial and ethnic groups, who also may have that intersection of social class or economics or socioeconomic status. With that delay, now the illness is more severe and there's less likelihood of getting the help. The studies over and over have shown that people of color get delays in diagnosis and treatment, and then it gets more expensive and it gets less likely, and it's less likely to work, are more likely to be hourly employees, not salaried, not have insurance. This is a crisis in our country. And so I think that it's very powerful for Lauren as a Black woman to say, like, I am also the face of cancer, and we need to pay attention, because I think that this is, to me, a huge healthcare crisis. We're seeing disparities even in COVID, right? How that's all been managed, the communities that were differentially affected. Cancer is no different. We see this in cardiac health. We see this in cerebrovascular health. In fact, there's not a health issue we don't see these disparities play out in. So it's really important that Lauren brought that up. I cannot impress that point enough, is that those delays in treatment can actually end up in people dying.
Mm-hmm. You said, Lauren, I'm quoting you in front of you, but you said, I saw a thing that said, protect our Black women. And as a Black woman, I definitely need protecting. We are not listened to. We're not heard. We do need protecting, as example with these studies Dr. Ramadi just mentioned. Lauren, you wrote a whole book, so we can't get through everything, but I would love your one big tip. You've been through it. You're still going through it. If you could shout it from the rooftop, what do you want to let people know who might be going through something similar?
Find your community. So whether that's online, you will need an outlet. So that could be someone who's going through exactly what you're going through, that you don't ever even talk about it. Right? So to your question earlier when you said, could you just hang out and watch TV? Absolutely. That's super fun. But when you go home and you watch TV tonight, pay attention to the commercials. 50% of them are medical or, about a medicine or a treatment to prolong your life when you have metastatic breast cancer. That's not something to say in passing. Or when you have congenital heart failure and, you've got stents, that's not something to say in passing. Those are super serious things that we're now glossing over and they've become just day-to-day speak. That's crazy. So I just think that, find your community and educate yourself. My best friend, you'll read it in the book. I'm very fortunate to have a best friend who's in the medical community, and she says that the opposition of fear is information. And the more that you inform yourself, the less that you're just going to have an irrational fear for the options that you don't even know are available to you. When you find your community, you'll find other people like you. You can band together, and then getting protection is going to be easier if you need that power in numbers. Yeah. And then your community will help you with the grants to get that money to be seen, mobile mammograms, things like that. Find your community, find your people, you'll get the help, but you'll need that outlet.
Really, really well said. Dr. Ramani, you have a fabulous series with MedCircle on the intersection between mental health and getting a life-altering diagnosis. We will link to that below, and I'll show a preview clip at the end of this video. But Dr. Ramani, same question to you. As a clinical psychologist, what's the one thing you want to tell people who are going through something similar?
I'm going to say something that is going to sort of stay on what my messaging often is, but might give people an interesting frame. Cancer is a narcissist. It lacks empathy. It's entitled. It's grandiose. It's arrogant. It wants all your attention. It wants to take over your body. And what do we know about people in toxic relationships? They need validation. They need support. They need they need to know it's not their fault. You know what I'm saying? It's literally, to me, when I've worked with clients who are living with cancer, I'm like, oh, cancer's a narcissist. We got this. We're going to put this one away like we did that nasty ex-boyfriend of yours. Yeah. And so that's, it's very much I want to echo everything Lauren said, but it's also, one of the things that happens with people when they have to keep facing down medical systems is it often feels like an interrogation of what did you do to bring this upon yourself, right? Mm-hmm. It's that blamingness. And it is that, as Lauren put it, sometimes your cells, they just work against you. Mm-hmm. And I think and so many people want to try to make sense of it. And so it can very much be, if it's not that they're saying, what did I do behaviorally? It might even be, am I being punished for something? Some people question their faith in God. This can really bring people to their knees spiritually, physically, in every which way. So I think that's where I want people to understand, get support, get therapy, ideally with a therapist who actually knows how to work with individuals who have chronic illness, who can make those allowances, who understand that sometimes you're going to do 15-minute sessions because the person's real tired, but they still want to have a session the day after chemo, whatever works. Sometimes they want to do it without a camera on or whatever. Before the pandemic, it was interesting. People who really worked in this oncology space of therapy, they learned that, sometimes a person can't get into the office, so we'll do it by phone. So it's working with somebody who understands this, who can work with people about grief, but get the therapy, get the support, recognize, like I said, cancer is a narcissist. So psychologically, you're going to need to sort of kick butt there, engage in that radical acceptance, and always remember that the only way out is through. Is that you just some days are just going to be harder than others, and that's okay. I think people have that one hard day, and they think, oh my gosh, I'm going backwards, and I'm like, no, you're right on track.
Yeah, really well said. In this session, my first guest is Brenna Crow. Brenna is a cancer survivor where she was diagnosed at the very young age of 21. Brenna, thank you for coming on and sharing your story today for our viewers.
Absolutely.
Why don't we start with a little more background on what your cancer journey has looked like?
Yeah, so I was 21 in New York City, like living my dream life. And I slowly just started to get super sick over time. And I was actually misdiagnosed for over a year before doctors actually figured out that I had stage 4 cancer. I had Hodgkin's lymphoma, and it was basically spread everywhere that it could be. And they had told me that if I had come in a couple months later, we would have been talking time instead of treatment. So it's been really crazy.
What was the misdiagnosis?
Everything. I was a college student. I was just super young. It was all in my head. I had every single symptom of Hodgkin's lymphoma, and no doctor really took the time to look at my symptoms and put 2 and 2 together. So yeah, it was a year of going to different doctors, dealing with symptoms that I just thought that I had to accept as my new normal.
If that doesn't tell you how important it is to advocate for yourself and get educated on whatever it is that you're going through, I don't know what will. This seems like the perfect time. We're going to jump right into it to bring in our other guest, Dr. Judith Joseph, psychiatrist in New York. Hi, Dr. Judith, one of our MedCircle doctors. Nice to see you again.
Nice to see you again, too.
Now, Dr. Judith, I want you to comment on that as a medical professional. What is going on? This 21-year-old woman is going to doctors, telling everybody her symptoms, and yet they're saying, "Oh, no. You don't know. This isn't anything. Don't worry about it." What's your response?
You know, I hear this a lot, especially with younger people who look healthy and are living their best life. A lot of times when they go to doctors, you know, it's a little bit of denial on the part of like the medical practitioner. Like, there's no way this person could be, you know, dying or have issues that could potentially lead to death. So it's like a little bit of denial on the side of the medical practitioner because, you know, I think it's hard for anyone to really accept the fact that someone young, vibrant, beautiful could potentially have something serious happening that could end in something like death. So, you know, I think that this is actually quite common in people who are young and have a sudden diagnosis of cancer.
Brenna, what is your current status on your health?
Weirdly enough, today I just went for my 8-year blood checkup, and I'm still cancer-free and healthier than ever.
All right. Fabulous. Now, during this journey, in this session, we're going to focus mostly on communication strategies. What struggles or obstacles did you face when communicating this diagnosis to friends and family?
Honestly, when I got the diagnosis, I had a good friend of mine and my mom and dad in the room with me. So that part, watching them really take that in, was hard because I knew in my head, like, okay, I'm going to be okay. I'm going to fight this. It's going to be fine. But it was really difficult to like portray that to them, to show them and tell them, like, don't worry, guys, like, I got this. We're going to be okay. So I think really just showing everyone in my life that, yes, being 21 and having cancer isn't ideal in any, means, but I was going to be okay.
And what about that friend that maybe you don't talk to every day, but you might talk to them once a month when they say, hey, what's new with you? How did you bring this up to them? Or did you?
I honestly didn't. I was so at that time, in contact with everyone that was close to me, like in college, all my new friends, everything. It was really difficult for me, I guess, just to say it in a way without being like, so I have some news. Like I just kind of was like telling them the updates because it wasn't like I just went to the doctor one day and they were like, hey, it was like figuring out what was wrong with me because they knew I was sick.
Right. Which in some way, I guess, would make it easier to tell them, here's what's the conclusion is from what's been going on the last year. Dr. Judith, certainly anytime we get a diagnosis, whether it's mental health related or cancer or something, we often need to communicate it to some people, but it can be hard, whether we feel stigmatized or we don't want to burden others with this. What are some of your clinical strategies for communicating this?
I think that bringing that up, that there are some people that can accept it and, actually be supportive. And for other people, especially if they're going through their own problems, it can feel overwhelming. And a lot of patients that I've treated have said that they were hesitant to share, their diagnosis with friends who were struggling because they didn't want to add an additional burden. So, this is something that I think depends on the individual. First, you got to really take care of yourself. It's hard to process such a, seemingly devastating diagnosis when it's first being handed out to you. So I think you first have to process it yourself. And then when you're in a place where you feel safe, you can start to share with others, because, to be young and to hear this, I'm sure it's quite, traumatizing and scary.
Well, Brenna said that when she heard it, she said she knew she would be okay and that she was going to fight it and come out the other end. Brenna, I don't think I'd react that way. Okay. I react pretty bad, for anything, let alone a big diagnosis with that. Why are you in that mindset? Why were you like that?
I think it was because I was so sick before the diagnosis that, like, when they said, okay, like, we think it might be cancer, I was almost relieved, because I was like, okay, there's something wrong with me and I'm not crazy. Because literally all the doctors had basically been like, it's all in your head. Like, you're fine. You're just going out too much. And to get a diagnosis of something that I knew could be cured, it was just kind of like, okay, that sucks. Yes, I'm not happy about it, but like, I'm grateful that there's a cure.
What do you think about that point, Dr. Judith, on the relief of getting a diagnosis?
It's very empowering to be validated, right? You're saying that you were sick, you weren't feeling well, and everyone kept saying you're fine. I mean, that's really invalidating. And so I think that, finally knowing what was happening with you was empowering for you. So I'm not surprised that that's how you felt. Like, finally, I know what's happening, so now I can actually do something about it, versus being told there's nothing to be done. So I think in your case, that actually empowered you.
Were you angry at the doctors who had missed it?
Yes, very. That was honestly where most of my struggle came from. The initial reaction, I was kind of like, okay, like, I can do this. But once it really, like, set in, I was very upset that no one could have caught it, because it's not like I wasn't going to the doctor. It's not like I wasn't telling them my symptoms. I trusted them more than I think I probably should have, and was really forcing myself to be okay. Like, I would feel sick. I'm like, well, they said you're fine, so this is just how you're going to feel. And that's the part that I really struggled with, was, accepting that all these doctors had, misdiagnosed me.
Have you accepted that?
No, I don't think so.
No.
I mean, I don't think I'll ever get over it. And that's really a big thing that I try to do with this kind of stuff, is tell people to advocate for themselves and not just accept an answer, because had I gone back and really pushed for even a scan, they would have saw it.
Yeah. Really interesting. I'll push a little further here, Brenna, on that. Do you think there will be a point in your life where you can move through that or accept it and maybe even come to peace with it?
I hope so. I would hope that I can get to that point. I think the more I'm able to share my story and, hear from people that say, oh, I got this diagnosis because I listened to your, information about pushing with with your doctor, I think that will, get me there. But yeah, it's one of those things that I just am frustrated with. And, it's a learning moment, but definitely tough.
I would love to hear from you, Dr. Judith, on that, because I can't obviously speak for any of our MedCircle doctors, but I can hear a few of them in my ear saying, she can be mad about that for the rest of her life. I mean, that is something she's allowed to be angry at. But if she does want to work through it, that's her choice. She can handle this and live with this however she would like. What do you think, Dr. Judith?
I think your answer is spot on. Coping with it by helping others who may be facing the same thing is quite powerful. And yes, I think you have every right to be angry. I mean, what if it had gone on for longer? Possibly it would have been too late. So, the anger is valid. And also your response is very healthy. You are still angry, yet you are doing things to help others so that this doesn't happen to other people. So I think that your response is very healthy and really appropriate, and also just like above and beyond. You're stellar. So I think a lot of people would not have, had that anger and then done something about it. They probably would have continued just feeling angry. You're actually empowering others.
Brenna, you are married. Correct. Yes.
Correct. Just
Okay.
a month ago.
Yes, brand new to a great guy named Kyle. When did Kyle enter your life, and did it overlap with any of your cancer treatment journey?
We had known each other since middle school. So he was around for the whole diagnosis and everything. But really on the end of it is when we started getting, more serious and hanging out and, seeing each other.
And so what was that like, communicating the reality behind such an impactful diagnosis with this person that you want to spend the rest of your life with?
Yeah, I mean, he kind of saw me at what I felt was my ugliest, like no hair. I gained a lot of weight and I wasn't happy with myself. So for him to just still like me and like want to be around me, I was like, oh, like this is interesting, because I had been in honestly a relationship while I was going through chemo and everything, and it didn't work out. So I was like, you know what, no one's going to want me until I, grow my hair back out and I lose this weight and I'm back to Brenna. So that having him just like me for who I was special.
Oh yeah, I can imagine. As you move forward and with your life and you meet new people or get new jobs or whatever, how much do you share about your experience with cancer, if anything?
I'm pretty open with it. I am not the person, I have a lot of friends that don't like to talk about it and they, don't tell people, but it's a part of me. It's a part of my story. And honestly, it made me a great person. I love who I've become because of it. So I think sharing it honestly is like something that's helped me with it and accepting it. At the time, it was a little dicey. I didn't like it, and I didn't like not looking like myself, especially around, all my beautiful friends at college and everyone's dating and doing all these fun things. And I just did not feel good about myself.
Yeah. Dr. Judith, I want to shift to talking about people who support those on this cancer treatment. When we're communicating with those people, what are some of the do's and don'ts when checking in on them?
I think that there are so many questions and unknowns, especially with cancer treatment and depending on the type of cancer, that when you bombard caretakers and supportive loved ones with more questions, it can feel very overwhelming, and it's not necessarily empathic. So when you lead with empathy, you put yourself in their shoes. Do you want to be bombarded with more questions? No, but what you would like is someone to listen to you, right? And I think that in my work with families that have people surviving with cancer in their families, it's really important to just be there. Just make it known that whatever you need, I'm here. Versus, can I do this? Can I do that? And bombarding with things that you think may be helpful, but may not necessarily be helpful, may actually be burdening the family. The other thing is that faith is really important. A lot of times, people rekindle, their roots in their faith during these times. There's a lot of evidence that shows that prayer helps. You may not be like a believer in God and so forth, but these mindful techniques really do help, not just the person who is going through the treatments, but the family members, and it can bring them together. So, a lot of times you really have to go back to the values of the family and to the individuals involved and see what helped them in the past and utilize that in the present.
Did you have any experience like that, Brenna, of truly, let's be honest, you're facing mortality in some way that most 21-year-olds don't. Did it bring you any closer to whatever faith you may have?
Yes, 100%. And it's funny because I wasn't a big religious person before, but my mom's good friend was very religious, and she was my mom's go-to person. She would go to her house and just cry. So she wasn't around me and I wasn't seeing her upset. Yeah. But she brought me to like church and healing ceremonies and had me blessed by a certain priest and all these things. And it's crazy because that's exactly like you said, like I really leaned more into it at that time because I had to trust that this was happening to me for a reason, and it really did open my eyes not only to my faith, but just trusting that God has a bigger plan for us.
Brenna, first of all, I really adore you. You and I were speaking before we started filming, and I just dig your energy, girl. So I'm going to ask you this question because I know you can handle it. Let's talk about, I know Kyle was so supportive during that time, But what did he do that you go, man, he didn't know any better, and I wish he didn't do that? I'm not calling you out, Kyle. We all make mistakes. I'm just trying to learn from this experience.
Honestly, I can't think of anything that Kyle did, but I can think of something that the person I was dating throughout did, which was very, hopefully he doesn't hear this. But he, I think, was scared to treat me like a normal person. Like to not fight with me, but to tell me maybe he didn't want to date me anymore or whatever it was. So that was very difficult for me. And like going through, you know, like I said, all my other friends are dating and doing all these things. And then like this person's just like, I could feel that they weren't being real with me. They were almost still with me like out of pity or something.
Yeah. So how did that relationship end?
I don't know. He just never talked to me again.
Oh, okay. So he made the choice to go.
Yeah.
So what was that experience like? You're going through a major obstacle, and this person who you, I assume, liked at some point bails.
Yeah. Honestly, I was just so supported in every other way. And this is when I, you know, started talking to Kyle and stuff again. So I was like, you know what? I would like to know why this ended the way it did, but I'm just moving on. I just kind of, it's weird. My brain was just focused on other things where I think if it was a normal day to day, I would have got very hung up on it. But I just kind of was like, if he is not going to be around at this certain point in my life, he's definitely not someone I ever want to be with. So
God, is that not an enlightened response? Well, I think it is. I don't know.
Yeah.
I love that. Dr. Judith, I would love your response on that. And also how people with a life-altering diagnosis of any kind can navigate the barrage of different types of support they'll receive.
Yeah, I mean, this is something I've seen with patients where their partnerships really didn't survive, right? But they survived, right? And I think that it is telling. If someone is not going to be with you through the, you know, one of the most difficult points of your life, then they showed who they are. So you got to believe people when they show who they are. The other thing is that it really can highlight strengths in other people that you may not have noticed along the way. You didn't realize how resilient your friends, your family members were. And
your mom's best friend.
Right. Yeah. These crises can bring out the best in others, not just yourself. So, you know, it's a learning situation for everyone involved. And so I totally agree with what you're saying. It really does allow people to show who they are.
At this point, Brenna, with your great news that you got yesterday, what does your new life look like? Meaning, is it what you expected or not at all?
It's honestly better than what I expected. I love the person I've become over the last couple of years, and just, you know, not only my relationship, obviously, but like with my jobs and everything, and being able to do this kind of stuff and share with people. So, like I said, it's weird to say and to think about, but I truly think cancer just made me think about life in a totally different way that really only people that are faced with like some sort of life altering, you know, situation can understand. Like, you really only get one life. And since then I have just, you know, powered through and just, you know, started checking goals off left and right. So yeah.
Love that. Dr. Judith, I'm sure a lot of people who watch this masterclass will be watching from the eyes of a supporter. And in some ways, I can hear Brenna, I hear what you're saying. You looked at the obstacle, you faced mortality, and it sounds like you realized what's important, what's not, and it gave you a new appreciation that maybe you didn't have before for life. I hear all that, and it sounds great. How can I, as a supporter, better understand that, Dr. Judith? And how can I actually learn from these incredible survivors and use those lessons to improve my own life?
You know, I see a lot of family dynamics where you'll have a family member coming in who just knows how to support the person who is in treatment without the person even asking. They just kind of really empathize. And then I've seen the other case where someone comes in and they're making it all about them. And it's, woe is me, my, you know, child, my wife, my so forth is suffering. And it can just drain the room, you know, an already depleted system. And so really think about what the needs are of the person. And yeah, your feelings are valid too. Find support for yourself separately, right? If you got to go to your priest, to your faith leader, to your therapist, whoever it is, get your support, get that taken care of before you enter that room. Because when you enter that room, that person needs you to show up, right? And it can't just be about you. And unfortunately, I see it both ways.
Yeah, the need for supporters to have support is not recognized enough in most communities. So if you're a supporter out there and you're going, oh, this is exhausting and tiring and an emotional like overload, you're probably right. You need some support. Find it, and Brenna's mom's best friend is not available. Okay. That's for Brenna's mom. You have to go find someone else. Brenna and Dr. Judith, it was fabulous to talk to you today. We'll include links to everything related to both of you at the bottom of this video, and we'll see you in that next session. Well, of course, a life-altering diagnosis just doesn't impact the person with the diagnosis. It impacts the entire family. Chris and Leslie know this firsthand, and they're here with us to share their story and some insight. Thanks for being here, guys. Appreciate it.
Thank you for having us.
Yeah, of course. Leslie, now you are sitting here today, a breast cancer survivor. Tell us a little bit about your journey.
So it started December 4th last year. Kind of our dumpster fire of 2020, just ended the year with a bang. And yeah, it was since then. I mean, I'm a cancer survivor now. It's been a tough journey, but it's been one that I feel has really brought us closer together.
In what way are you guys now closer?
Well, when you're first married, you take that vow in sickness and in health, but you're living really in health for the most part. So we finally got that opportunity, and I use that word intentionally, to live the in sickness part. And that's a test, to any marriage, that's a test. And I think we really rocked it. We had a chance to lean on each other. We had to figure out how to tell our kids. We had to figure out how to manage our jobs. So I believe that it was just really, I've said to a lot of people that breast cancer was probably the best thing that ever happened to me. And I think I'm crazy.
Wow.
And I get that that's definitely not the experience for many, many people. So I don't want to minimize that at all. But for us, it definitely was something that brought us closer together, just having to lean on each other, just having to actually lean on other people too. So it wasn't just leaning on ourselves, it was leaning on our family and friends and being able to accept the help, even though we're pretty independent people and we didn't want to burden anybody. But I mean, all of that just compounds, your life and just makes you together, just makes us stronger.
Chris, when you found out about your wife's diagnosis, what was your reaction?
Disbelief initially, even though she was really confident. I think in that paradigm when we were going through the testing and then to diagnosis, I was hopeful and optimistic, and she knew right away. So I was in there just trying to temper that, trying to listen to her so she was heard and felt heard, but wanted to make sure that I was remaining hopeful and optimistic. That's kind of my role, I think, a little bit in our relationship. So, but then when you hear and when I heard, all I wanted to do was to take that away from her, and couldn't do that. So that part was difficult initially when that happened, because as part of being a husband and wanting to be a protector and someone that can help right away, I knew there was just in that moment, there was nothing that I could finitely do to improve the situation.
It's so nice to hear that you guys were able to come together and not only lean on each other, but your external support groups. But was there any tumultuous times between the two of you? I mean, marriage is difficult from what I've heard. So I imagine that this just makes it more challenging. Were there any really hard times because of this?
I guess when I think of the word tumultuous, I think of like, were we fighting? Were we, that's kind of where my mind goes. And the answer is no. I would say that I had a very dark moment right before, actually on the days leading up to my biopsy, when I had gone in for a mammogram and they said that the mass in my breast had grown and I would need to have a biopsy. Just my mind just went to the worst place initially. And before I even was diagnosed, my biggest fear And I woke him up one night. So I guess he probably didn't enjoy this, but I woke him up at like 2 a.m. I was crying. I said, I'm really afraid that you and the kids are going to have to watch me die. And, one of my fears was like, obviously we're very young, so he's going to meet somebody new, and I would want him to meet somebody to raise my kids, and what woman in this world could ever love him and my children the way that I do? So I was going through this crazy thought process, and he just has a really unique talent of kind of knocking the crazy right out of me. So he was able to bring me down. That was really the worst moment that we had, but we didn't really have time for fighting. We didn't really have time. We had to make sure that we were strong for our kids. We did not want this to impact them at all in a negative way. So I guess tumultuous, no, we didn't have that.
A personal question here, and of course, everything is up to you, what you're comfortable answering, but did you have any surgeries for your breast cancer?
Yeah, I did. I had a bilateral mastectomy, which was, I guess that was a tumultuous time now that I'm thinking about it, just that decision. So it was very stressful. Being able to make that decision, some people would say that's a blessing. I felt like it was a curse. But I did make the decision to have a bilateral mastectomy. And so leading up to that, there was a lot of stress, a lot of unknown, a lot of him having to kind of carry me and reassure me that everything was going to be okay.
Chris, how was it being this, it sounds like very incredibly supportive, caring person, because this isn't a short-term journey here. This is long-term. This was a year-long battle, let's call it. How did you handle all of that personally?
I hope I handled it well. I think I did. But you mentioned, you talk about marriage, and it can be a difficult process, and it is in good times and in bad times. You have to make a choice when you tell somebody and their family that you're going to be with them forever, through sickness and health and better and worse. And so when you do that, that's just what you signed up for. So that's kind of how I felt the entire time. People ask me, like, how are you doing? Like in the moment, while we were in it, they were like, well, how are you holding up, or how are you doing? And I always think, like, what I'm dealing with right now pales in comparison to what she has to go through. She's the one that's going to have to go through the multiple surgeries. She's the one that has to kind of frame all of this in her mind. And, she's very expressive with her feelings. So I knew how she was feeling. So for me, like that, I'm fine. Like if I could have taken it from her, that would have made me better, but I was fine. And, part of a healthy, faithful marriage is the service component of it, where you get to serve one another and put the other person's needs in front of yours. So through this journey, I got to do that for her. And it was easy for me to do that for her. And sometimes you take that for granted on the, like, oh, I made coffee and breakfast this morning and no one noticed me. Like those things happen on a normal basis when you're just going to work.
Yeah.
I always notice when you
but like that really was a blessing for me, because like I got to serve her each day, and I knew it was super impactful and important to her. And that's what made it worthwhile and worth doing.
Well, Leslie, that sounds like what every woman would want their husband to do and say through this experience. But the truth is, not everybody can show up that way. All of our experiences and all of our environments are unique and different. And at the end of the day, we all do the best we can do. Was there anything that Chris did that really helped more than maybe the other things? Something that really stood out?
Yeah, he looked at my boobs before I had a chance to do that. I was terrified to look, I didn't want to look. I didn't want to, I was just terrified. I'm like, what? It looks like I'm going to have been hit by a bus and flattened over. He was like, it's not that bad. And I don't know if he was lying to me, but even if he was lying, he did a good job, and he said, it's not that bad. So actually I just had that in my mind. And when I finally got the courage to look, I was like, oh, it's not that bad.
You've heard it here, gentlemen. Look at your wife's boob. It's what they want. It's what they want. Now, you both are obviously parents. You made the decision to share this experience with your children. We've talked to other people in this masterclass who made a choice not to share their diagnosis with their children. What made you decide to fill them in on this?
Well, naturally, I'm an oversharer anyway, so that was not even an option. I was going to have to tell them about this. Plus, it was stressing me out to think that they were going to overhear a conversation or, see something in writing. Our kids are 11 and 13 now, so they're not little, and they're not, it's not like we can hide a lot from them. We're a very close-knit family too, so we're always together. So it was kind of a no-brainer. I was diagnosed on a Friday, and we told them on Saturday.
Wow. One day after. Now, how did you? Wow, that's incredible to me. How did you go from that Friday meeting right into your Saturday meeting, and how did you tell them?
Well, we found out in line getting Christmas lights at
Home Depot.
Because
Merry Christmas.
Yeah,
Yes.
right. It came through on her My Chart because we elected to get the results as soon as possible because we knew it would be over a weekend. So we went right from there out to dinner together and kind of just figured out like, okay, what does this mean? After we freaked out in the car for 15 minutes and called her parents, we went out to dinner and it's like, okay, what does this mean? Initially, it was maybe we shouldn't tell the kids for a while. Let's get another test. Let's get this further down the road. And then ultimately, what we didn't want to do is end up in a place where we knew we were going to need the kids to trust us. And we didn't want to start off this journey in a place where they would be like, why didn't you tell us when other people knew? Because we knew that we're going to tell her that mom is a healthy woman and we're going to fight this and she's going to be okay. And we needed them to trust in us. So it was our choice to just lay it all on the table at that point.
And so by laying it on the table, walk us through the specifics if you're okay doing that. You sat them down and told them what?
Well, I made him do that.
Yeah, of course, Chris. Yeah, your job.
I don't remember what you said.
Yeah, right around the island where all the important things in this family happen in the kitchen. We just sat down and we were very I didn't want to beat around the bush. I just wanted to tell her, we have something very important to tell you. We started off with things are going to be okay. Things will be okay, but mom has some, I didn't use the word sick because you're not sick, but I said, mom got a diagnosis and she's going to have to go through some things. And then we just kind of walked through what it was. And obviously at 13 or that time, 12 and 10, they've heard cancer. They knew what the word meant.
Sure.
So they had questions. And so Leslie got to engage very quickly because they had lots of questions for her and for me about what that meant, what was next. And, they were shocked, I think, and emotional initially, as you'd expect them to be. But it was actually more natural than I had anticipated it being. It really was. I thought it would be a little bit more difficult to have that conversation and start that. But they were, again, I think the trust piece in the family really helped because they believed what we were telling them. And I think they believed that because we were genuine in everything we were trying to say to them.
Did they ask any questions that were surprising to you?
They did?
Are you going to die?
Oh.
That was the first question that we didn't probably anticipate off the bat.
Are you going to die? And that was hard to hear. That was hard. But right away, it was just like, well, no, that's not what this means. And I think a lot of people hear cancer, especially kids, and they automatically think it's a death sentence. So we wanted to squash that right away. And after the conversation, we just kind of went about our day.
And over time, did any of their reactions change, or did they find more difficulties as your treatment went on?
So our daughter, she's our oldest, and I think her reaction to the type of surgery I was going to have was, she struggled with that a little bit. She was like, well, what does that mean? What do you mean they are going to be removed? And so she and I together looked at pictures of mastectomies and the whole progression from mastectomy to reconstruction. And she was like, oh, well, that's, they're going to look normal again. And I said, yeah. So, yeah, right. So she was really, just going into it, I think she felt relieved having been able to look through some pictures with me and realize that for a little bit, it's going to be a little ugly, but then it's not going to be so bad.
How is I know you said at the top of this interview that your marriage is great. It's brought you closer together. It's perhaps stronger than ever. How are you doing individually?
Today, well, I would say for me, I'm finished with everything. So my last surgery was on May 19th. That was my reconstruction. Now I'm at the point where I'm like, this is over. I don't have a fear that it's going to return. I think I went really aggressive with my treatment so that I wouldn't have that fear of it returning. But I'm still at the point where I'm like, it's over. And looking at myself in the mirror, I'm like, oh, I look like that now. I mean, I don't look like what I used to, which was never going to be the goal. And, my surgeons let me know that was not the goal. So I never felt that loss and grief originally, where I know that a lot of women, initially felt that, after a surgery like I had. I feel a little bit now. And I don't know if that's because time has gone by and I've been able
you feel a little more grief now?
I feel loss and grief from everything that I went through.
Got it.
So I'm feeling that now, not that it's impacting my day-to-day very much, but it's there.
Well, yeah, sometimes you're in survival mode, you just got to get through it. And then once you're on the other side, you can take a deep breath and go, whoa, we just went through a lot. And now I can start the grieving process finally. I really understand that. Chris, what about you? How are you doing individually?
I think of all the stressors that this year's brought on. Now I think of whether it be from work or with pandemic, I think those things are things that stress me out more than the diagnosis and the treatment and all of this. Like for me, being able to watch how Leslie handled this throughout the entire time and how she was empowered by it was really helped to kind of feed me and helped to give me a perspective that was like, if this woman can go through this, like in this fashion and be this open and share and be this strong, and like we'd wake up every morning at 4:45 so she could go work out before and after surgery, and like just to see that strength in her really it motivated me and it inspired me. So I feel like through all of that, again, it's in my effort to serve her, she probably served me better and more and made me confident in our marriage and confident in everything else. So I feel like of all the things on the list of things to complain about, like that whole experience it was good in comparison.
Oh, that is really motivating to hear. It seems like you guys both really handled this incredibly well. There are many couples out there who don't have the same story. They, for whatever reason, have a partner who doesn't show up the way they wish they would, or the person struggling with the diagnosis isn't handling it as best as their partner wished they would. I would love to hear your advice to our viewers that you have for your counterpart. Leslie, what advice do you have for people supporting those with cancer? And Chris, what advice do you have for those people going through the cancer treatment?
That's a really good question. So advice for people who are supporting those with cancer, I think you just need to listen to their needs. And really it's about understanding your partner, not even listening to the needs, because I don't know that I was really communicating needs. I always go back to, the 5 love languages, that book. I think the author was Gary Chapman, but if you know what your partner needs, you don't have to communicate that. For me, it's like he knows that I am acts of service. I think he would also say that it's gifts, but I disagree. But it's more acts of service that is really something that makes me feel loved and makes me feel valued. And he understood that. So I think it's really just that understanding of your partner.
You mentioned before, like how we manage that. And I do have to say that a big part of it is our faith in God. And we leaned on that immediately. And I think that feeds into kind of how we've structured our marriage and how we communicate with one another, and the act of like the idea of serving somebody else, like obviously is a direct reflection of Jesus Christ. And so I think that's the perspective I tried to have on all of this, is recognizing that even though what we're going through can be major in some aspect or in some perspective, like in this perspective of the entirety of how good or bad things can be, that this too can be considered to be a smaller incident if we framed it that way and felt that way. So that made it easier for me to deal with and manage as a caregiver, I guess. And I think the thing that if I were going to give an advice to someone in the same shoes that I had is that it's not your job to fix it. It's not your job to make it all better. It's your job to make your person as comfortable as they can be, and so they can feel as supported as possible. So even if this is something that it's out of your wheelhouse that you don't like to do, like at that point, you just kind of have to suck it up and figure that out, for lack of a better phrase. Like your momentary, minor inflictions not worth comparing to what's going on in their life. So you kind of have to just figure that out for your family and for your wife.
What do you think your marriage gained the most of from this experience?
I don't know. I would say trust. I would say, we're not going anywhere. Like we have a very solid marriage. This is not the hardest thing that we're ever going to have to go through as a married couple. There's going to be harder things out there. There's going to be loss, more grief. So I think being able to trust that we can get through something like this so that when the big thing happens, we're going to be okay.
Chris, anything to add to that?
It's solidify how dependent we are on one another, and that's not I don't mean like codependent in a bad way.
Yeah.
Weird. I don't need to be analyzed right now, but we really are dependent on which one, and which is what marriage is supposed to be, right? That you leave your families and you come together and you're one, and that is we got to go through sickness and health, and we got to look through all these things, and we still like each other. We still want to be around each other. I still love her more each day that we get a chance to go around to do this again. So I think that part has really been solidified.
And what do you think your kids have gained through going through this experience?
A lot of talk about boobs.
Yeah, I bet boobs is just like, another word around the house now. Big deal.
Right.
Yeah.
I always, on my social media, anytime I was posting about my journey, I would always do, hashtag check your boobies. And I had to remind our son not to go to school and say that to people. So, but yeah, no, I think it's really, one, they know that mom and dad are going to put them, they're going to be first, no matter what we're going through, we're going to make sure that their life is kept as normal as possible. So I think they've gained a lot of trust in us, and knowing that we're going to put their needs first. We're going to keep their lives normal, no matter what challenge is thrown at us. They know that they can still depend on us.
Well, it's certainly I would say a beautiful story. And even though it started from a very devastating moment, it seems like the two of you and your family as a whole have truly made the best out of it. And as you said at the top of the interview, it was an opportunity that you guys chose to take advantage of and are now stronger today. And I think that message of hope and resilience is going to resonate with a lot of people. And I really thank you for being brave enough to come on here and share with our viewers.
Thank you.
Thanks.
Awesome. Well, thank you guys for being here. And you can learn more and check out our social media. Feel your boobies. Remember, check out our social media at the links below this video. I'm very pleased to have our next guest join us for this masterclass. Marissa Sullivan is here. She's a journalist, writer, producer. The list goes on and on if you follow her on Instagram. Marissa, thank you for being here.
Thank you. I'm excited to do this.
So let's talk about your experience with cancer.
Well, I guess I'll start out at the beginning. I was diagnosed with triple negative breast cancer on my 40th birthday. Yeah.
Happy birthday.
It was fun, let me tell you. And that was 2019. And it was quite an experience. And you know what? From the start, when the doctor came in, I was initially diagnosed with stage 1. And she came in and I saw on her face, I knew. And she told me stage 1. I was like, okay. what's going to happen with my hair? And can I still go to Paris next month? Like, I wasn't even phased. I was just like, oh, like I had read enough about breast cancer. We've come such a long way. The early stages, you have such a high survival chance. And then it was my 40th birthday. She called me and she said, you have stage 2, grade 3, triple negative breast cancer. We need you to start chemotherapy immediately. And that's when I was like, okay, this doesn't sound good.
Yeah.
And I had no idea there were even different types of breast cancer when I was diagnosed. I just thought you just have breast cancer or you don't. I had no clue. And then, of course, I started Googling it up, and, you hear or you see headlines, the deadliest form of cancer, all over the place. There's no positive news items about my type of cancer. So, yeah, it was a bit jarring, but you know what? I just slipped on some leather pants, went to the Madonna concert that I had planned on going to that night with my best friend. That really did set the attitude and the tone for how I took this beast on. So yeah, I had to do 5 months of chemo and then radiation. The whole process took almost a year. So, and then the doctor was like, oh, do you have kids? Nope. Do you want kids? I'd like the option. Okay, well, you have to freeze your eggs immediately right before chemo. And I was like, whoa. So that was probably the toughest part emotionally going into it, because I had family and friends weighing in, like, what are you doing? Like, you're waiting 2 weeks to have your chemo start? Like, let's not worry about Marissa Jr. Let's worry about Marissa, because without Marissa, there's no Marissa Jr. So, yes, so that's when it all started getting a little gnarly.
So you ended up freezing your eggs and delaying the chemo 2 weeks.
I did. They fast-tracked me through the process, but it was that emotional roller coaster, because it's like you're navigating the fresh cancer diagnosis, and then you're injecting yourself with hormones every day to mess with your head even more. And it was, and I guess the main reason I'm here is because I was navigating, I was in a pretty toxic marriage, and, navigating all of that through my marriage and relationship. I mean, it was memorable.
I think when most people think of cancer, they immediately think of the treatment and surviving and getting through that. And then as they progress, they start to realize, oh my goodness, this is impacting so many areas of my life. And for a lot of people, it's primarily the romantic one. You mentioned you were in a toxic relationship with your husband when this diagnosis came up. What was his reaction when you filled him in on what you had learned?
So, and this is the exclusive for you guys. This is the first time I'm telling the story. And I've told a lot of my story. So, but this was the private pain that I hadn't really shared yet, because I wasn't really ready to. But I think the day before I was literally the day before I found my own tumor, because I did find it myself. I was not doing a breast check. I'm very in tune with my body. I just happened to absent-mindedly put my hand right on it. And I just kind of knew. The day before, I literally told my husband that I wanted to leave him, that I had also met somebody else, and I had been in this very toxic relationship, and I think it was a means to try to get out. And so we were going through all of that. And then the very next day, I'm laying in bed with him, and I just kind of put my hand on it. I yelped. It was like the size of a walnut. It was hard on that, my left breast, top outer quadrant. He put his hand on it, and I could just see in his face, his reaction made me just start panicking, because I just knew, like, I was like, oh my God.
What was his reaction?
He looked pretty terrified.
Okay.
Like, I knew it was, because sometimes people are like, oh, I learned that 80% of tumors are benign, non-cancerous. But there was just something about this, like, I kind of knew, but then when he reacted, he freaked out, and it made me freak out. And I, luckily, I'm very proactive. I am a reporter. I literally got on the phone within 0.02 seconds and got myself in to check it out. So that was just something, honestly, with triple negative, it's so aggressive. There's so many women that are scared to find out that their tumor is cancerous, so they'll put it off. And a month or two could have cost me my life. I probably wouldn't be here right now. So that is just so important to I promise you, dying is way scarier than going to the doctor and dealing with your
life
cancer diagnosis. So don't put off going to the doctor.
So you had this moment with your husband. At that point, though, you weren't really, doesn't sound like you were too thrilled with the state of your relationship. How did your relationship evolve once you had the cancer diagnosis?
You know what? It did. And then my conversation with myself came back to me. I'm like, well, maybe this is meant to be. Maybe, I had a good feeling from the start that I was going to get through it. And I'm like, what if this is happening to test us, to bring us maybe back together and strengthen our relationship? So it actually did improve things. And I was very, very hopeful. He's a good guy. He has a good heart. It was purely, we were, and I own up to my side of the street as far as the toxicity goes. We just weren't meshing together. It wasn't anything specific he was doing to me. It's just we just weren't working. But we did initially have our relationship strengthen. He was definitely there for me. But I don't know. I think once I started chemo, and I feel like if I was bald and looking sickly, maybe he would have taken it more seriously, because I feel like just because of my bubbly nature and because I still look fairly the same like myself, I'd still get done up and put on my red lipstick. I think that almost hurt our relationship, because it didn't hit him, and then he started slipping back into those same patterns and, maybe not treating me how I should be treated, and vice versa, I'm sure. And so then things just took another dip, like for the worst. And I just had to get out. So I literally moved on, 3 weeks into chemotherapy, I had to deal with moving. So,
and was moving part of a divorce, or was moving just a step in the relationship?
It was let me get through this cancer and then we can see what's up. Because honestly, if I hadn't gotten out, I don't know if I'd be here. It was that toxic. And I just urge anyone who's in a toxic situation to get out, even if temporarily. You need a quiet sanctuary to go through all of this. And I can't imagine if I hadn't had the courage to leave, I don't even know if I would have made it through. I am super, super happy and in a new relationship. Again, I never knew, I don't know, a lot of people are scared to leave their spouse. They don't know if they're going to meet somebody else. And I promise you will. Like if it's meant to be, things will align, and they did for me. And it's crazy because all the steps going through cancer, and then mind you, during the pandemic, that's another thing. Pandemic started while I was in the midst of my chemotherapy. Wow. That was fun.
So in 2020, you are going through the pandemic. You are fighting for your life, going through chemo. You are exiting a toxic relationship and rebuilding a new life yourself. One of those things is certainly a challenge. Doing all of them at once has got to be astronomically challenging. How did you meet your current partner, and how did you tell him about your history with cancer?
Yeah, it was tough at first because, here I am. And I think it's important just to briefly touch on, I did freeze my eggs. I don't have children, but I am 41 years old. And, it's like some guys in these apps, like some guys know what they want. They're like, okay, you maybe can't have kids, deal breaker. But you know what? so that was a little, scary, because I'm like, oh God, this is gonna like whittle down the dating field for me. Because I had recently been told that I probably can't have children. I have since found out that my hormone levels are back to normal. And after doctors told me I couldn't have children, I just found out that it looks like I probably can. So I want everyone out there to know that you have to keep getting tested. I went and got my hormones checked, and I think maybe the medication hadn't fully worn off. Sometimes it takes like a year, because the chemotherapy can obviously destroy your eggs, and that's hence the reason for the egg preservation. So I think I'm okay in that area, but time will tell. But he was a trooper, and he's amazing. And yeah, we're starting this new life in New York. I just moved to New York City. So
Yeah,
20
literally
years in
just
Los
a day ago. So her furniture comes tomorrow, everybody. Now, I really appreciate your transparency and your willingness to talk about that. I'm just so everyone knows, she certainly saw the outline before I asked this question. I'm not hopefully prying, and you don't have to answer anything you don't want to. But in a post-cancer life, in this new normal that you have, how has sex changed, if it has at all?
Oh my God. Yeah. But I thought, so I had zero sex drive, which is normal, because you're put on this. I had to do this shot called this Lupron shot, and that it messes with it's supposed to help protect your eggs. Scientifically, clinically, it messes with your libido. So I had no sex drive. I literally just wanted to survive. I just don't care if in my head, I said to myself, I seriously don't care if I ever have sex again with anyone. I just want to survive and get through cancer. And
so when you had the Lupron, you did notice a decrease in your sex drive, but today with your new partner, you would say that your sex life is healthy and at a place where you are happy with it.
Yes, I would say my sex drive has increased more than it has in a long.
Oh,
and I was always pretty, I guess, pretty sexual, but because I've met people out there that have healthy sex lives 20 years into the relationship, and I'm like, I want that. So I didn't want to settle for anything less.
Well, this has been, I appreciate how willing you are to speak about this. As somebody who's now gone through this, and you have your 1 year of being cancer-free and this great relationship, what would you tell that person out there who's starting at step one? They just got the phone call before their Madonna concert that said, hey, your life is about to change.
Oh, fine. I didn't know anybody who was going through it. It took me a little while. I would say, get help. There's organizations out there. Doctors are so busy, especially we're still, dealing with the pandemic. I mentor through Immerman Angels. It's an organization out of Chicago, and they match people up based on your age and, your stage of cancer, the type of cancer. And so I mentor, and, I write a lot. I write for a cancer news site called SurvivorNet. My whole career shifted more into the health space, and I'm so grateful for that.
Very sweet. Well, and we'll make sure we link to Immerman Angels at the bottom of this video. Marissa, thank you for everything that you're advocating for, and good luck with the move out in New York City. I hope you get adjusted soon.
Thank you so much. Thank you. This has been great.
If you don't have a smile on your face right now, you will in just a little bit. Our next guest, Johnny Immerman, always comes with a big smile. Johnny from Immerman's Angels, welcome to MedCircle. Thanks for being here.
Kyle, thank you. Thanks for having me. Thanks for the team. Welcome me. It's a pleasure to be here. Pleasure to see you.
Of course. Well, let's jump into this and get your history and background with cancer.
Yeah, I grew up in the Detroit area. I was 26 years old, just a couple years out of college, and diagnosed with pretty advanced testicular cancer. Went through chemos, went through surgeries, the better part of about 2 years, and was the last thing in the world I was thinking about. You're going to the gym, you're hanging out with friends, you're going on dates in your 20s, just not thinking about things like cancer. But at the very end of treatment, the important part is a group of young survivors and I finally met each other, and we all buddied up. We wanted to give back. We wanted to find purpose and meaning. We realized the broken part of the cancer journey was none of us knew survivors like us from the start. And that's when you're nervous. That's when you're scared. That's all the unknowns, the question marks, the fear of the unknown. And so that's why we created a nonprofit called Immerman Angels, which is a one-on-one mentor program. So anyone diagnosed with any form of cancer anywhere in the world will find you your twin, someone who survived exactly what you have, that's walk, who says, I relate, I've been there, here's what you need to know, and I'm living proof. I've gotten through my cancer. You can do this. Or I'm thriving through the cancer years later, and you can also thrive if it's someone in stage 4 situation where they're probably going to live with it for the rest of their life. Someone who's 10 years thriving with that stage 4 lung cancer has a lot to empower and motivate someone who's at year 1 of stage 4 lung cancer.
When you were diagnosed, what year was it?
I was diagnosed in 01, October of 01, so just about 20 years ago and 1 month ago. 46 now. Time flies, but it was one of those things that, most people in the 20s, you're just not thinking about something like cancer, and it just comes out of the blue. And so we want to make sure there's a community for everyone, that everyone feels they have somewhere to go when they feel isolated and scared and they hear those words for the first time, you have cancer.
Well, yeah, back in 2001, too, you didn't pop on Facebook. I don't even think MySpace was around yet. So you really couldn't find, your group or your people back then. So I can imagine how difficult that would be. When that happened, what did you find that you needed most? Was it that community and support?
It's a great question. I needed my mom. She was there every minute, every chemo, every surgery. My brother's my best friend. My friends were great. I definitely needed that too. No question. That was the first thing. But then when I looked around, this family and friends support, which I needed, none of them could look in my eye and say, oh, I understand exactly how you're feeling. Like, oh, I've done this before. I've done chemo. And so, that quickly became the next need. Important need was, God, isn't there someone in this whole hospital who's actually done this before that I can actually talk to and pick their brain? It just seems so straightforward and so simple to be like, let's just, find someone like you who knows what it's like to lose a testicle, knows what it's like to start chemo, have a port surgically implanted into your arm. And how does that feel? Like, what should I eat on chemo? What should I not eat? Can I go to the gym? How much energy should I expect? Am I going to throw up in the first hour or, 200 hours into this? Like, when does all this stuff happen? So that became quickly the most important need beyond my family and friends, was talking to others who simply understood their experience.
Yeah, it's a reoccurring theme that I hear over and over again. Certainly, MedCircle, we typically only talk about mental health, but I say only, and you can't talk about mental health without talking about everything else too. And it is after, even not even after, but medication important, treatment's important, all that's important. But what all of these survivors tell me is the thing that really changed it all, the thing that got me through it, was whatever that community was that they built around them. I think it's probably easier to do today for at least most people than it was 20 years ago, just because we've got computers in our pockets. But where people really struggle is what a good community comprises of. So I'm asking you, the king of building communities, what makes a great supportive community?
Well, love all those points. And I'm not so special, but I will tell you who is special is the community itself. I mean, we're like, the Immerman Angels is like the best example you can think of how community helps everyone, right? Everyone benefits because you have to have a network of survivors. When somebody's diagnosed in Miami named Amy with stage 3 ovarian, we don't know who in the network is the closest person to connect her with. So, that might be this person, might be that person, this time this person, the next time that person. But like the community together is how we're strong, is unity and strength. And to your question, Kyle, building community, I think the first thing is that survivors are grateful, at least in our channel, right, of this community. Survivors are grateful. They've won their life back. They want to find purpose and meaning. And then when you find other people who also want to find purpose and meaning, and they do it selflessly, these people are not paid. There's no glory. There's no recognition. There's no accolades. They simply volunteer their time, their energy, their story that oftentimes is terrifying to think about mentally, from a mental health standpoint. Like, it was scary for me and for all of us. But to go back into it because they know it's greater good, is to talk about it, to share it, to shed light literally for someone on the same path who's terrified in the darkness, just like we all were. They do it because they're grateful, and they do it because they want purpose and meaning. And so I think it's easy to build community when you're around other like-minded people who see the world that way and want to do something positive while we're here in this short life, and give back. And so the community kind of snowballs. Once we got to a few people, it kind of snowballed, and then other survivors like, I'm a survivor too. That's what you guys are doing? Like, of course, I'll be a part of that. Like, they're just something that they wanted to be a part of, because ultimately it's just so selfless, right? They're not getting anything back other than the satisfaction that you mentored and walk somebody, hold their hand through every mile of the marathon to cross that 26.2 mile finish line and watch it happen and be a part of that. Like, I really don't know what's better in life, but when everyone feels that that's what they want to do, the community sort of has this same value system of giving back, and it sort of starts snowballing.
Yeah, really well said. I remember when I lived in LA, I guess I could call him a mentor. He said, everybody should go do something selfless, help somebody else, go to a soup kitchen, donate their time, energy, whatever, and not tell anybody about it, not put it on Instagram, not, shout it from the rooftops. Just do it and have it be something that you've done for others, but for yourself as well. It's my understanding that Immerman Angels, though, isn't just for those who have been through this life-altering diagnosis. It's also for people who have lost somebody to this and can mentor that way. Can you talk a little bit about that?
Yeah, well, really well said, Kyle, from your friend, because that is so true. And I'm sure you know people. I know people, and I know what they do, and I know what they're doing on Saturday, saving the next animal or a homeless shelter. And you'll never see it on LinkedIn. You'll never see it on Instagram. You'll never see it on social media. And I think that truly those are probably the happiest people out there, because they're simply doing it because they know it's the right thing to do. They don't need to post about it, right? And you don't have to PR your own good works. I mean, you just do it because it's the right thing to do. And I think that's how you get the full dose of happiness, right? It doesn't have to be promoted. So I totally agree. So sorry, I commented on the first part of your question. What was the second part of the question? I apologize.
No, it's fine. So in Immerman's Angels, for those who have lost somebody to a life-altering diagnosis, is there a mentorship program for them?
100%. So Immerman Angels will still help people who have lost someone that they love. We'll help anyone touched by cancer. It could be, we call it caregiver to caregiver matching. So it could be someone who is in their 40s, let's say a couple in their 40s or a person in their 40s loses a child at 7 years old to leukemia. Those parents we can match, or that parent we can match with another parent or set of parents that say, you know what, 5 years ago I lost my child at the same age to leukemia. I never thought I would find happiness again. Here's how I coped in year 1, year 2, year 3, year 5. Like, what's that mental health roadmap look like of caring for a child and losing your love, your most precious thing in the world, and how to get back to a place of peace. And I have a lot from people who have gone through this and the ones who mentor with us. One of my close buddies in Chicago, my buddy Dave, he lost his wife after 4 years of marriage at 32 years old. They were both 32, married at 28. And once she passed away, he became a mentor well, years later, I should say. First he coped with it, then he became a mentor. But when you talk to Dave, what he'll say is that I never thought in year one that I could ever be like, 50% happy again. Like so much of me was gone.
Yeah.
And now I'm like, I'm 95%. He is married now to another person. He has kids with that person. He does holidays occasionally, I think once a year at least, with his former, his first wife's family. He has the one new wife has a relationship with that family. I mean, it's just this beautiful story of just overcoming that tragic loss and finding peace and finding family. And he volunteers for Immerman Angels. He shares his story. I mean, that's what people need to see and they need to hear, right? That somebody figured it out. How'd you do it? And somebody right in the throes of it, and that first week or month or even year of losing a spouse or a child should talk to someone who's 5, 7, 10 years out. There's so much to gain.
What is something that you still see is missing in the cancer journey?
The cancer journey can always get better. I'm a big believer that we do a great job, but we can always get better. The most glaring missing piece that's broken out there to me is the disparity in healthcare, and that we are not able to reach or support with services, whether it's hospital and healthcare directly or nonprofits, reaching people that are under-resourced, undereducated. Maybe they're immigrants, they're new to the country, they don't even speak the language very well, how to navigate the system. To me, that is by far the biggest need in the cancer journey, is we need to do a better job of reaching those that are under-resourced, that don't have money, don't have knowledge of the system, are new to the country, maybe don't speak the language. Like, what are we doing? How do we do a better job of reaching them? Because the people that have means are going to find great doctors.
Yeah.
They're generally more educated. They're going to get great treatment. They're going to find support organizations because they have laptops and internet access to find things like Immerman Angels or Stupid Cancer or Cancer Support Community or all these other great groups that offer things. Patient Advocate Foundation out of Virginia is one of my all-time favorites, who helps with insurance problems. But unless we're doing a better job of reaching those who are under-resourced, who really need the help, we're not really winning. We got to do a better job of reaching people that really are either poor or under-resourced.
And for that individual who either just heard the words, you have cancer, or is in the middle of their own cancer treatment journey, what is your best piece of advice?
Right in the very beginning, Kyle, when you hear those words, you have cancer, I think we all sink to a dark place and we are scared, we're nervous, we're fear of the unknown, your mind's racing. I mean, the first thing I want to tell someone, and of course I'm very biased with our work, and that's why we picked what we do, but it's just to talk to others who understand. Connect with others who get it and are simply have nothing to gain other than just to help you, and they care. It's just like a beautiful part of humanity that someone that was a stranger yesterday now says, I had the same cancer as you, and I know what you're feeling, and I know a lot of things you should know about how this treatment feels or that treatment feels, or how to get rid of the tingling fingers. You're tingling in your fingertips with neuropathy from chemo. I've got a great tip for that. Put it in warm water. It'll dilate the capillaries, increase the blood flow. You're going to start to feel better. Foods, eating blander foods, not spicy foods on chemo, generally idea. But all these fringe questions, these survivor tips, we figured it out. Survivors have learned. And unless we're helping those that are just starting the fight, we're not really making it easier and better for them. So that would be the first advice. Once you hear the words, you have cancer, connect with others who understand. Also connect with your family, your friends. You need all the support, but definitely those who understand, and groups like Immerman Angels that are free and will always be free. Take advantage of it. We have people lined up, ready to help, ready to make your day easier, ready to help make sure you're asking the right questions to your doctor, making sure that nothing slips between the cracks. People are there to help. We just got to make sure that there's enough awareness that they can find groups that give that help and they can get the help they need at the right time.
Awesome. Well, thank you so much, Johnny. It was a great to meet you over Zoom. Hopefully we can meet in person one day, and you can learn more about Immerman's Angels using the links below this video. Appreciate your time.
Thank you, Kyle, for all you guys do at MedCircle and mental health. Keep up the great work. So important. What's more important than the mind? Keep it up.
Awesome. Thank you so much. No question that life after a cancer diagnosis is different. That new normal requires a lot of adjustment, and perhaps nobody knows that adjustment better than Kyle Hanagami. Kyle is an incredible choreographer. I'm a big fan even before this, and also an artistic director. Thank you for being here, Kyle.
Thank you for having me.
Let's start with what your story is. What is your experience with cancer?
Yeah. When I was 27, I was diagnosed with CML, leukemia. And I was very, very, very sick. Got admitted into the ER and diagnosed. And it was kind of something that you don't see coming.
Mm-hmm. And when you got that diagnosis, what type of treatment plan was laid out before you?
So I was very out of it because I was so sick. And let's see, we had to do, I think, 4 or 5 blood transfusions. I had to do the pheresis, where they like hook you up to the machine and it like filters out the white blood cells. They started me on oral chemo and a bunch of other medications that I don't really remember the names.
Of course, yeah.
It was a lot going on and a lot to deal with, especially when it's so out of the blue.
How are you doing today?
I am still not in remission yet. It's something that I'm still kind of dealing with. But everybody has something.
Sure. Well, and that is certainly the topic of this conversation, is that here you are living with cancer. Your life continues on. And I think a lot of people end up in that situation where they say, all right, I'm not in remission yet, but I still, maybe they don't say I got to go to choreograph this new dance routine, but they still have to do their own thing. How did you, or maybe you still are, how do you adjust to this new normal?
I mean, I want to preface this by saying, like, I did what works for me, and I want to make sure that what works for me is not what I think other people should do, because I don't even know if what I do is like the right way to deal with things. I just, like, for me, I wanted to make sure that I kept everything in a positive light. So when I was diagnosed with cancer, I didn't want to know anything. I didn't want any information. I really felt like the way that your mind is connected with your body. I really believe that if you have a pessimistic outlook, it can have detrimental effects on your body. So for me, I didn't even want to have those thoughts in my head. So I kind of avoided all of the research. And there's so much misinformation out there, and everything from friends telling me conspiracy theories about the cures already out there, and there's eating habits that cure cancer, or certain foods from various countries that cure cancer. And there was so much information coming at me from so many different directions that for me, I chose to kind of focus on just kind of living a good life.
Yeah. Well, I mean, focusing on living a good life, I don't know when that would be a bad decision. I'd love to introduce Dr. Lamb to this conversation now. Dr. Lamb is a MedCircle doctor and psychiatrist in Southern California. Dr. Lamb, fabulous to see you again. Thanks for being here.
Thanks for having me. Yeah, I appreciate it.
Dr. Lamb, from a clinical perspective and a psychological one, what would you say to somebody who goes, you know what, I just got a big diagnosis, but I don't need to know all the details and all the research. I just want to focus on living, to quote Kyle, a good life.
I would say what incredible insight you have about what you need. So often, we think that there is one way to go, there's one right answer. And with cancer, with mental health, these are multifactorial disorders that we have to live with, and that everybody has to look in and get clear what's right for me. I'm working with a patient right now who's working with a blood disorder, and she wants to know everything. She was asking me if I could get access to the medical school library, and so that she could get everything. And she recognizes that she's an outlier, that some people want to be more middle of the road, and that there are other people who really don't want to know all the details and really want to find the provider that they can trust and say, I'm putting this in your hands. And the most important piece, I think, at the beginning of a diagnosis is giving yourself permission to say, what's going to work for me? Am I somebody who needs a bunch of information that's actually going to calm me? Or am I somebody who wants to find the provider that I can trust in and say, I'm going to leave this in your hands and only tell me what I need to know? So I just think it's really, Kyle, so respectable that you would, at such a young age, know that about yourself and be able to kind of operate that way, because we get inundated with information. And it's one thing to get it from your provider and then the internet and family and friends. And again, I think that I wish we could say there's this one path to health, and it's just not the case. And that with each different diagnosis, different things are going to work for different people, and being able to create that individualized path for you is so important.
Kyle, as someone living with cancer, are you clearly you're open to talking about it, but in your circle of friends, in your social circle, how do you communicate that with somebody? I bring this up because some people say, my friends are always asking me how I'm doing, and I wish they would just ask me how my day was instead. I'm trying to understand how you navigate your diagnosis within your social circle.
I mean, I think it kind of blends between my social circle and my work life, because when I was diagnosed, one of the things that became an issue that wasn't before was, I don't want, one, people to take pity on me. Two, I don't want to become known as the choreographer with cancer.
Yeah. Yes, I get that. Yeah.
Yeah, it was just one of those things that it's something that you have to learn how to maneuver around and deal with, that people who don't have cancer just don't really see it as an issue. Yeah, so a lot of it is just kind of explaining. I think when I was first diagnosed, I kind of explained to my friends what I just explained to you guys, which is, I don't really want to overanalyze anything or think about it too much. For me, I think that if I focus on the things that I love and the people that I love and the positivity in my life, that I'll be okay.
I've heard this term many times, perhaps most of our viewers have, called scanxiety, and anxiety around upcoming scans. Have you experienced increases in stress and anxiety when you go in for follow-ups with your doctor?
All the time.
All the time.
Yeah,
Yeah.
absolutely.
And how do you deal with that? How do you deal with that part?
On my own, which is probably not healthy, but
now is on your own a choice, or just the circumstances?
I mean, there's a little part of me that there's two parts. There's, I don't want to bother people with it. And then alongside that, I also don't want to constantly be asked about it. And I feel like bothering people with it may open the door to constantly being asked about it. And for me, as someone who's like, that's not the way that I choose to deal with it. It just seems like something that I would much rather try to avoid.
So it's interesting to hear that, because here you are on this platform. Certainly a lot of people will see this, and I imagine many of them will find you on social media and reach out to provide words of encouragement, ask you questions. Is that, how do you feel about that?
I mean, I think that there's a big difference between the focus being on me and the focus being on someone else. Like, I've had people reach out and ask questions, or like people who have been diagnosed, or if I've done something with Make-A-Wish for a girl who had cancer, like we would talk after her wish and then continue talking. And like I would provide information, and I think that there's something nice about being able to share that with someone who's going through a similar experience.
Yeah, it sounds like part of your healing is the advocacy for others, and perhaps part of your healing is even showing up here today to share this story, because it is in conflict of, you know, wanting to put your head down and focus on living a good life, to bring all these things up. But maybe when you impact others, you know, it can heal you. Dr. Lamb, scanxiety, real thing.
Absolutely.
What is your recommendation? The queen of anxiety right here, Dr. Lamb. What is your recommendation for people who are really struggling with that anxiety when it comes scan time?
Absolutely. So one of the most important things is acknowledging it and letting it be okay, right? That most of us have learned to push away from our anxiety, to not look. And the idea is not to dwell in it or to make it, I think, Kyle, your point of not wanting to be a burden or not wanting to put it on anyone else, that really this can be internal work of just noticing, wow, this is really anxiety provoking, and what can I do even physiologically to regulate my anxiety? If we don't notice it, it can come out in other ways. If we don't allow ourselves to say, yeah, there's a reason why I'm feeling more jittery, having some ruminating thoughts, or in my case, I get irritable when I'm anxious, right? Different ways that it can manifest. And if I can then attune to myself and figure out how to regulate right through ways of either breath work or meditation, things that we can do to calm ourselves. Positive affirmations can be very helpful. And, you know, one of the things that I've seen for some people, and again, Kyle, I so appreciate your getting clear about what works for you and what you want. For some people, it's really an individualized work. For others, it can be very helpful to reach out to their family members who may be just as worried as they are, and that they can talk about the fact that this is a scary time. And I know every time my mom is recovering from breast cancer, and every time she has her scans for checkups, it's a really anxiety provoking time for all of us. And being able to say, all right, this is that time of year. Let's sometimes it's just through distraction, making a joke, all the different ways that we can calm our nervous systems in the midst of it. So for some people, reaching out and having the community around it can be very helpful. Otherwise, being able to really just attune to ourselves and take care of ourselves, to notice the anxiety as a physiological experience in our body and regulate. I don't want to make an assumption, but I'm guessing that dancing might actually be a great anxiety regulator if I think about my own use of exercise and those kind of things. I'm curious about that for you, Kyle.
No, absolutely. I mean, for me, I go to the gym every single day. I dance a lot. And I love my job. I love my work, and I love the people that I work with, and it kind of just helps me through.
Dr. Lamb, I'm putting you on the spot right here, but do you have a question for Kyle that has come up that you would like to ask him?
Gosh, I guess in many patients that I see who are highly anxious, who are seeking out treatment, are looking for more information. They want reassurance. They want to engage with other people. And so I'm curious from, people who don't want to seek kind of looking at it with somebody else, I don't usually see. So I'm curious about the things that you have done to keep that focus on your living the good life, and how you keep those thoughts at bay, what you do, what's helpful for you.
To avoid looking at too much information.
Mm-hmm. And thinking about it all the time, or worrying about it.
I mean, I think one of the big things is just staying present.
Mm-hmm.
It sounds like such a like it be such an obvious thing, but it's something that takes so much work and it's so hard to do. And it's something that I'm still working on to this day where, and I promise you, I'm not this hippy dippy as I'm coming off, but in terms of like, yes, I may have a blood work or going to see my oncologist in a week, but I'm not thinking about that because I have dinner with a really good friend that I haven't seen in a while, or I have a rehearsal that I'm really excited about, or a project in the works that like I can't wait to go home and hop on a call for. Like there's so many things that I'm doing now that take so much more, or in my mind should take much more importance over what's coming up.
Yeah, it is a great question, Dr. Lamb, and Kyle, your answer I think resonates with everybody. It's a reoccurring theme that we've discovered during this series. A lot of people who are going through something similar will say the same thing. That I talked to Lauren in a previous session, and she said, I think I took a day or two off after my surgery, and then I was right back to work, because for me, I wanted the normalcy. I wanted to be bored in a meeting or reading a memo because that was just better for me. So I think it's fabulous that you're willing to be so open and transparent about that reality. Kyle, I'd like to leave it with you. What are your go-to pieces of advice for those who are either on their cancer treatment journey or supporting somebody who is?
I guess there would be two. The first one is find out what works for you, because you're going to get so many different pieces of advice along the way from people who are knowledgeable and people who have no idea what they're talking about. So
that's just good life advice, honestly. I mean, how many times does that happen?
Right. But you're gonna hear so much. So like take it all in and then evaluate what you think is right for you and what isn't, and make your own decisions. And the second piece of advice is it's okay to change whatever decision you come to. Really? Sometimes you might start thinking like, this is what works for me, and you try it and it doesn't work. And it actually does more harm than good. And it's okay to not stick to your guns and go ahead and make a change to figure out a way of dealing with things that is more conducive to your life.
Yeah, the permission to change your mind. That is a real thing, y'all. Everyone has that permission. You can change your mind. Absolutely. I love that. Kyle, thank you for being here. I really appreciate all the work that you've done with MedCircle for this initiative, but also outside of MedCircle. I really appreciate it. And Dr. Lamb, great to see you as always.
Thanks so much.
Thank you.
Thank you for watching this. You can learn more about everything we discussed, FCancer and MedCircle, using the links below. Remember, whatever you're going through, you got this. Thanks for watching. Check out the links below for more information on how to access this full series, and subscribe to our YouTube channel to watch new mental health videos every week. Did you like what you heard in this video? If you want to ask a MedCircle doctor a question directly, you can learn how by visiting the links in the description below.